In the absence of a mayor, I'll call the work session to order, and I will ask Al, can you do the roll call?
Okay, I'll do roll call now. Am I too loud there?
Nope, you're fine.
Okay. Benson,
Here.
Sarda, Commissioner Sarda. We'll pass for now. Fertig,
Here.
Hoffner,
Hoffner, present.
Hoffner's present. Minor,
Minor present.
Minor's present. Moser,
Mosier here.
Moser's present. Schramm,
Schramm, present.
Schramm is present. Weber,
Weber's present.
Weber's present. Mayor Johnson,
Johnson is present.
Mayor Johnson's present. City Manager Leon,
Leon present.
City Manager Leon's present. City Attorney Denherter,
Denherter present.
Denherter's present. We'll go back to Sarda. Sarda, are you with us?
Okay. Well, thank you, everyone. We'll start off with public appearances. Dave, is there anyone who has called in with input not related to an item not on tonight's agenda?
We do not have any phone calls at this point.
Brad, how about YouTube comments?
There are no comments at this point.
And Colleen, how about email?
There are no emails at this time.
Thank you very much. With that, I will turn it over to City Manager Amy Leon to introduce tonight's topic, which of course is the COVID-19 ordinance we have in place.
Thank you. And for a roll call, Al, I do see that Sarda is present as well. So if you will mark Sarda as present, we'll move forward with our agenda. So before you tonight at your regular commission meeting, you'll be visiting about our ordinance number 1033. And that's the ordinance that we have in response to COVID-19 and some of the business closures that you have suggested or recommended, as well as alternative business operations in some cases, public gatherings, etc. So we're looking for your direction this evening as to where you want to take that ordinance. And I sent a lot of different options to you, and I could not exhaust them all because there could be any number of those. What we wanted to do is give you some ideas of different ways you could take the ordinance, different directions you could take with the ordinance. I do have a health board recommendation for you, and so I'd like to give that to you first, and then we'll be introducing our speaker, who you all know, but will give us some additional information. So the health board met today, and their recommendation, which was sent to you, was that you consider extending the ordinance, the timeline on the ordinance, for another 2 weeks. So extending it to May 15th, reconsidering then that ordinance at your May 11th meeting. However, the health board did recommend that the businesses, including dog groomers and tanning salons, be omitted from the ordinance, provided that they follow CDC and OSHA recommendations for operations. So that's the health board recommendation. And when we get into the deliberations or discussions, you can ask questions of health board members if you'd like regarding that recommendation. I know there's some other thoughts out in the community. You have gotten a lot of public input from us today that came in over the weekend, and you'll probably get more as well. However, in the meantime, I want to thank and introduce Doug Ekren, the CEO of A Very Sacred Heart. I did email you the updated numbers that he is going to visit with us about as well. So if you want to pull that up on your screens and in your packet, it is part of the commission packet on our website as well. People would like to look at that. Mr. Ekren is going to give us a review and some of the latest numbers that our local hospital is working with to help us guide in our decision-making process. So with that, Doug, I'll turn it over to you.
Okay, thank you. And thank you all city commissioners for all the work that you're doing. Obviously, there's a lot of moving pieces to this whole COVID situation, and we learn something new, it seems like, every day that changes some of our perceptions. Excuse me, I'll walk through this evening will be the latest projections that we have for when we think we will have our surge. Just because it is maybe a little later in getting here than initially projected doesn't mean that we still won't have it. Our population doesn't have immunity. At some point, it will be here in greater numbers than what we have today. And so I'm just going to start on page 2 of the presentation that says South Dakota minus Sioux Falls. So if we take the Sioux Falls metro area population out of South Dakota, we end up with about 634,000 people. We know that from people who are infected, about little over 8% of those individuals who are infected need to be hospitalized. Vast majority do just fine, and we'll talk a little bit more about that on the next page. So out of those that are hospitalized, about 30% of those people need intensive care unit level care. And this varies a little bit region to region, country to country, but that's a number that at this point we're comfortable with. And then about 70% of those people who need to go into the ICU eventually need to be on a ventilator. And so it's concerning to us, and why there's been so much focus on trying to flatten the curve so that we can spread that volume out over time and appropriately manage those patients. So based on what we know now, a person is infectious for at least 14 days. The length of stay for those people that are hospitalized is typically about 13 days. Obviously, some are much longer than that, some are shorter, but on average 13 days. For the people that have to go in the intensive care unit, they stay there about 10 days, and people that go on a ventilator average about 8 days being on the ventilator. So some people obviously get very ill. I think we're up well over 56,000 deaths now in the U.S. From COVID. Going to the next page, here's one of our challenges, is that about 50% of people who are infected have no symptoms. And so that's a challenge for us in trying to determine how many people in a given community actually have been exposed, because we simply don't have enough testing available at this point to test big segments of the population, let alone the community at large. And so of those who are symptomatic, about 40% have mild symptoms. They just stay home, they deal with it, they never get tested. And so we're probably underreporting the overall number of people in a given community that have COVID, but we just don't know that for sure without the test to prove it. So about 10% have more severe symptoms, and those are the ones that are likely to be tested and end up with that group that ends up being in the hospital. So going to the next page, if we look at our peak infections, and you'll see 3 different graphs here, and the graphs are really built on 3 different variables, and it's really called the doubling time. So how many days does it take us as a community to double the number of infections? And if it happens more rapidly with 4 days, then you'll see that first dotted line spike, which would mean that outside the Sioux Falls metro area, if COVID positive cases double every 4 days, we would expect that on about June 19th, we would see a peak of 173,000 plus infections in South Dakota, okay? Conversely, we also have one in the middle with the dark green line, if that doubles every 5 days, and then one that's every 6 days. And you can see by looking at this, the longer that we can spread this out and flatten the curve, if you will, the further out in the summer that the peak number of infections takes place. So if we go to the next page, this would be looking at a 7-county area around Avera Sacred Heart, the 7 counties in South Dakota and Nebraska that typically we see a significant amount of hospital patients from those counties. And so the one that we would like you to focus in on is the red line. So it's kind of the middle of the pack of the one. And this is the one that we think is most likely that the doubling time will occur over a 5-day period. So that would suggest that over those counties in and around Yankton County, that we would see about 13,000 people infected. But that peak infection comes in late June, early July. So it's a little bit later than what we had proposed. Now, this is all subject to change, and this is nobody's crystal ball. It's just based on the analytics that we have today. If we suddenly had a Smithfield Foods event in Yankton, similar to what they had in Sioux Falls, all bets are off. This time frame may change significantly then. But at least at this point, the projections, Dr. Dave Basil with Avera, who some of you heard speak to the health board last week, he's worked with epidemiologists to develop this model and this data that we're sharing with you this evening. So if we go to the next page, this is the piece that I'm concerned about. So Avera Sacred Heart Hospital is licensed at 99 beds. We typically see patient numbers in the 30s this time of year. With that red line, the model that we think is most likely, in late June, early July, we could see as many as 120 COVID patients only at Avera Sacred Heart, based on that footprint where we usually see patients come to us from. That does not take into consideration non-COVID patients. People will still be having babies, they'll be having heart attacks and traumas and that sort of thing. And so in our planning, we are actually looking at the potential to deal with patients that are on that first curve, the 165. So we're building our surge capacity plans to take care of that number of people, and actually more if we have to move off site. So how do we mobilize enough staff, enough personal protective equipment, all the supplies that we will need, ventilators and things like that, to take care of that amount of patients. Now, we're much more comfortable with that number being 120 than 165, and honestly, we would love for it to be 89. That means we're stretching this out longer, and the longer we can stretch it out, the more we will know about the virus, the better that we can treat it and prevent it from having this impact on patients. So that is where we're at. Overall census, the next page would say, if we follow the red line again, during our peak, we'd have 34 patients in our ICU and 19 patients on ventilators. We can manage that type of a population here at Avera Sacred Heart if the model is correct. If the model gets higher than that, then we're going to have to rely on assistance from other facilities, other communities to help us manage that load, because we simply won't have the resources, both in some cases from equipment and supplies, but more likely it will be a manpower issue. We will have beds and places to put people. We simply won't have enough professional staff to take care of all of them. So that's a big challenge. And keep in mind that when we look across the country, about 30% of the healthcare workforce becomes infected with COVID themselves. So either from taking care of people and not having the right personal protective equipment, or not following some type of protocol, or they get it in their personal life in some way. So when you take 30% of the workforce out and then have to deal with a surge that might be 4 times what our normal patient activity is, that's a challenge. And so that's why you're hearing so much from the healthcare sector to please help us extend this out as much as we can. Now, we have to recognize this is a novel disease. We're learning more about it. All of the things that you see and hear on the media daily about asymptomatic shedding of virus and so forth. We learn more about the epidemiology, the modeling and assumptions. And so there's no guarantee that these are correct, but they're the best that we can do with what we know today. And this may change next week or in a month. And if they do, we'll share that information with you as well. But I think it's clear that the social distancing, the hand hygiene, the wearing the masks, all of those sorts of things are helping from a healthcare perspective. We realize that you have other decisions that you have to make from an economic perspective as well. And I don't know if this helps or creates more challenges for you. I can tell you that at our testing center, we're testing on a weekday, usually 10 to 15 patients. Weekends are a little bit less than that just because there's not as much clinic time in the community referring patients in. We're seeing about 5 to 6% of people having positive tests. So that's not a high number at this point. So we're comfortable with where things are at today, but that certainly could change shortly, as we've seen in Sioux Falls with the Smithfield situation. So I will pause there and see what questions you may have about the model.
I have a question, Doug.
Yes.
Amy Miner. Can you talk a little bit more about the criteria for the testing? We're hearing lots about testing. What criteria do people go through in order to get the test? Do we have enough tests? I know the testing is all being done out at the
We
surgery
did
center.
Yep. On our Fox Run campus is where we have that set up so that we can take the samples there. And it's done by referral, so it's not just anybody can drive through. And the reason for that is we simply don't have enough testing supplies. And while we now have equipment at Avera Sacred Heart Hospital where we can process tests here, but we're limited. The testing supplies that we're able to get is only for about 20 people a day. So for beyond that, we send tests to Avera McKinnon, and Avera McKinnon sends tests to Mayo for volumes that they can't handle locally. So we really think testing is a key, but we simply don't. We get more lab equipment that can perform the test, but we don't get the supplies that are needed to test as many people as we would like. And so there has to be a prioritization of people. And so we look at people that are being admitted to the hospital. We look at healthcare staff, so our doctors, our nurses, or others that may have the potential for exposure anyway. We want to look at people in senior settings, so long-term care facilities, assisted living facilities. We just know nationally what has happened in some of those facilities once there is COVID exposure to them, and that some of the high-risk populations that are there. And I think as we move forward and because we have shut down elective surgeries and other kinds of things, I think as we start to ramp up some of those kinds of things in the future, we'll also look at prioritization of some of those patients so we're not exposing either other patients during surgery and post-op and pre-op kinds of things, and we're not exposing our surgical team. Because keep in mind, when you're intubating and extubating a patient and you're down in that mouth and the throat area, you've got the potential for a lot of aerosol borne exposure to the team there. And so those are things we want to take a look at. But the testing's got to catch up with it. And it's getting better every week, but it's not at a level that we would like it to be at this point in time.
I appreciate it. Thank you.
Mm-hmm.
Yeah, this is Commissioner Sarda. Can you hear me?
Yes, I can.
All right, thank you. I didn't have a question. I just wanted to make sure my mic was working.
Doug, can you tell us with this middle line, the middle course that we think is the most likely scenario for Yankton or the Varsity Art region, that assumes some level of social distancing, correct?
Yes, it does. It does. And we know people are frustrated by that. And I mean, I think it's one thing if we said, well, in a couple of weeks, we think we'll be past the worst of this. But now when you start talking about July 4th, I think that frustration will increase. And that's a real challenge because for us, the more that we relax the restrictions, the greater likelihood for a higher rate of infection, which means more hospitalizations, more ICU, more ventilators, and so forth. At the same time, we understand the economic challenges that this creates for a lot of business people. We're in that boat as well. We voluntarily shut off a lot of our business in the middle of March, and we're feeling that as well. So I know that those are difficult decisions. I would just ask, as you move forward, please look at what type of guidelines and safe practices that you can share with the public, so that if you do reopen businesses, that you do that in a way that's as safe as possible and help us to spread this out a bit. I think everybody is in agreement. We want to keep our community safe and healthy. But part of that is economic health as well. And we just have to find that balance point. And so I don't know where that balance point is. I just know that if we can stretch this out longer, we can probably have a more positive impact on the health status of our community.
Doug, this is Stephanie Mosier, and I'm curious, and you may not have an answer for this, and I totally understand, but this is kind of following up Mayor Johnson. What is this modeled after? Because what's very confusing, and as you know, is there's many communities in South Dakota that have different rules as far as what businesses are closed, what aren't. You drive down the road and Mitchell has different rules than we do. So do you know how they are putting this data together with so many discrepancies? I think one thing we are all in agreement is social distancing, but obviously some of the conversation we have to have tonight might be, what do we do with some of these businesses? Do you know, or maybe my question doesn't even make sense, kind of how are they building this model with so many communities in South Dakota following different rules?
Yeah, good question. I think what they looked at is just a spread rate across the state of South Dakota based on overall what we're doing today. I can't give you more specifics than that, but those were the assumptions that the epidemiologist and Dr. Basil and the team had looked at, was that rate of spread that they expected. And so they have kept the surge in Sioux Falls actually in mid to late May, based on the rates that are happening there. And yet the new positive cases are actually decreasing in the Sioux Falls area. And so whether that will push back their surge date or not, I don't know. But because we've been focused more on what does this mean for our community and our service area, including those smaller hospitals and long-term care facilities in those 7 counties, and ensuring that we can work together, because there's going to be some of those really critically ill patients that they don't typically keep in those small communities. And some of those folks are going to end up in Yankton and elsewhere. The good news about Sioux Falls having an earlier surge is that there may be capacity in Sioux Falls because they've gone through their surge when we have our surge here. And so that could help us either from a resource allocation perspective or for a transfer of patients to that area. I think the reality is, though, that whenever this surge comes, we're going to have to get to a point of living with COVID. Until there is a vaccination that protects all of us from this and any variations of this virus that may occur in the future, this is not going to be, let's get past the next 30 days, 60 days, pick your number in terms of a model or what you think it might be. We're going to have to figure out how we live with COVID and how we live with peaks and valleys of people being sick in our communities until this gets a lot further down the road. I mean, like 12 to 18, 24 months down the road, from what I am hearing. And so I think that's the piece that we've got to figure out. How do we keep people healthy? How do we maintain and restart our economy, knowing that we may ramp things up in one sector and all of a sudden here comes another wave of infections and we've got to step it back for a little while, take care of those folks, prevent it from spreading to others, and then move on. Quite frankly, at this point, we don't even know if people can get it twice. And you've been hearing some of that in the media in the last few days. There's just so much we don't know yet, because this is still a relatively short period of time for a virus like this and for us to understand it. The good news is just about everybody in the world is working on it. And so that's why every day we learn something new.
Doug, this is Stephanie again. Sorry, a follow-up question. You mentioned at the beginning that this is kind of cross-referencing counties in South Dakota and Nebraska. So are Nebraska formulas built into this, or are you just using South Dakota data to kind of calculate what it may mean for our 7-county region?
Yeah, we extrapolated South Dakota data and applied it to the county populations in Cedar and Knox counties.
Doug, this is
Commissioner
Mason.
Sarda, just go ahead, Mason.
Okay, thanks. The data modeling, this is using the presentation you gave us is using the CHIME, or the hospital impact model for epidemics. There are other models out there. Has the hospital system here looked at some of the other models, or have they solely just been using this one that you've used in the presentation?
No, they reviewed some other ones, but this is the one that they've landed on that they think is most accurate and most probable for us. But again, there's no guarantees, and not to say there aren't other models out there that are more accurate or less accurate. This is the one that we've landed on and are building our plans accordingly. Okay, there's another question or comment out there.
Yeah, Doug, thanks. This is Dave Sarda. Just first of all, thanks for putting all this information together. How you guys have put it in. It's nice getting it from a source that we know versus reading it on the internet. So appreciate that. You did mention a good comment that it is a juggle, right? We got to get that balance. So it's a tough one in front of the commission. And you know what I like about Yankton, we are a small enough community that we can react quicker than some other places. If something does come up, you know, we could set up special meetings, we can get together, we have everybody's focused on this. So we are fortunate to be in a smaller community to be able to react fast too.
Yeah, and I think the other thing I would add to that is that there's a lot of conversations that take place between the city and the county and the healthcare providers and others. And I think that's a very good working relationship. We want to be transparent and open in terms of, and that's why we're sharing this model. We've also shared it with the media so that people have a feel for what we think could be the possibility, or at least the scope and the scale of it. It's hard to wrap your arms or maybe your brain around it when we have only a few cases in Yankton County, and most of the cases that we have recovered. But we just simply haven't felt the full extent of that yet. So, I think so far, at least from our collection center, we've had 23 positive cases in Yankton County. There's a couple of others that are out there from people that were tested elsewhere. But out of our 22,000 or whatever population in Yankton County, to only have 23 positives, we're going to have more than that going forward. The question is when and how many at the same time, and then how many of those need to have this higher level of care. And none of us know that for sure. So we've built this off of what we know from other places and other communities. So it's our best guess as of April 27th, and that might be different next Monday, but this is what we know as of today.
Doug, this is Mason again. Have you received any indication that we're going to be able to increase the amount of testing going on to give us a bit broader picture of how serious this is in Yankton?
Yes, and I think every week that goes by, Mason will have more testing capability. I know we've got a number of other things that we're working on. I know Yankton Medical Clinic also is looking at some things. So the more tests, I don't think it's going to be one answer. It's going to be this piece and that piece and that piece together is going to give us significant enough testing to be able to do what we want. And we're going to have to keep working on the screening practices that we have while we wait for that lab testing. And those screening practices actually, I think are being updated this week from CDC as they have some new symptoms that they're adding to that list. And so if we can keep doing those things all help. Again, they're not a cure. It doesn't mean that we won't have COVID in our community, but it will help us control the spread.
Doug, I have a quick question for you, again, about resources. I asked you about testing earlier. In addition to the health crisis, it appears around the world and across the nation, there's been a crisis in resource management and how to get resources where they need to be. The governor did a press release today that said moving forward, medical facilities will be on their own in terms of finding PPE. Is that accurate, or do we have enough PPE? Is the medical clinic working in conjunction with the Vera? And PPE is going to be a vital part of how we reopen, right? The individuals choosing to wear PPE out in public, how do you anticipate the average person accessing that?
Yeah, great question. I'll go back a month ago when we shut things down. We have enough PPE on hand for I'll just say our regular volume of patients, but we did not have anywhere near the volume of PPE needed for the types of volumes that we're talking about today. And in part, without knowing exactly that we were talking about 120 patients on July 3rd, we knew that number was going to grow significantly, and that's why the elective procedures were shut down. And so we've been able to build our inventories up to a much more comfortable level, and we're still trying new products all the time because it's one thing to wear that mask or wear a face shield when you're seeing a patient for a few minutes, but when you do that for 8 hours a day or 12 hours a day, and you do that every day, that's difficult. And so we're always looking for products that are, I'll just say, more comfortable, but still effective for our staff. But they also have to be things we can clean and reuse. And so I think and we have the strength of Avera and our supply chain and purchasing power to ensure that we have those products. Even still, we've had orders that have been, I'll just say, reassigned to elsewhere in the country, especially as major metropolitan areas have peaks. We're not seeing that so much right now. And so we feel pretty good about where we are at with PPE. The state has had some supplies, and they have shared some of those with healthcare providers. And I think they've distributed largely what they have had on hand so that those supplies are out there on the front lines and ready for when needed. And then on the backside of this, there is a tremendous amount of production being started from whether it is GM and Ford making ventilators to lots of other companies making everything from disposable gowns or reusable gowns and hand gel and all sorts of other things. So while it is, it's probably not evident to the average person today that a lot of those products are much more available now than maybe what they were a couple of weeks ago, that supply inventory is going to continue to build. And so I think people will find those products. Right now, the cloth masks or some type of a mask that you'll see a lot of people in the community wearing right now, that's a great tool. Now, I would say you do need to take those things home and launder them. So if you've been out in the community with your mask, when you get home, wash that thing in hot water, dry it in hot, and so that you're not simply taking what could be a contaminated mask and then contaminating yourself at home or others in your home. So those things all help. They're not as good as the N95s or the combined with face shields and so forth. But for most people, you don't need a lot of that stuff. I think for a lot of our employers, we're going to have to figure out how do we make the workplace, a safer place so that we're not contaminating our coworker next to us or vice versa. And so we just have to think about things maybe different than what we have historically. So, and I don't know that that's something that necessarily you as a city commission can do. I think each of us as individual employers need to think about that. You can certainly help set the tone and reinforce some of those basic principles, but we're going to have to figure that out in each industry. And with the idea that we're going to have to live with COVID, that it's not going to be gone by the 1st of August.
Thank you. Just a quick follow-up. My computer's threatening to overheat. So if I suddenly disappear, it's because it spontaneously combusted, and I'll call you back on the phone. Secondly, I appreciate your commentary. There's this sense that we get to sort of go back to normal, and it's a new normal. And so we're going to have to be accustomed to being in restaurants and having servers with gloves and masks and things. And businesses need to be thinking about what that looks like, how to keep their workers safe, as well as how to keep their patrons safe. Thank you.
Commission, any more questions? All right, if not, I just want to take a moment to thank Doug Ekren for visiting with us this evening and sharing this information that is pretty impactful, I think, in our decision-making process. So thank you, Doug. You're welcome to stay, or you can move on to the rest of your evening.
I'm going to move on just because I have a few other things to do. Plus, I was informed that you have others joining you at 7 o'clock, and I don't want to overload your system. So thank you all for the opportunity to share this with you, and thanks for all that you're doing for our community. It's very much appreciated. So I will sign off. Yep, take care.
All right. Commission, we have a lot of work before us tonight, probably, to figure out where we're going to go. So in speaking with Amy Leone and how we should move forward through the meeting, we thought it would be good just to start going through the ordinance as it exists and seeing if there are changes, with the thought that if there are major changes, we would have a meeting later this week to give staff time to implement those changes into the ordinance and then approve it. Amy, did you want to start walking us through that process? And maybe once again, remind the commission what the health board recommendation was as a starting point for the conversation.
Of course, health board recommendation was to expand the ordinance for 2 weeks. However, to also then eliminate dog groomers and tanning salons from the ordinance, allowing those to operate, understanding that they would operate with using the protocol set forth by OSHA and the CDC. The reason for that was really that those were not 2 uses that the health board originally had suggested be included in the ordinance. And then, with the understanding that this could then be reevaluated on the 14th, or excuse me, on the 11th for consideration. So all the other items in the ordinance to stay the same. That being said, we are, aware of the discussion that you've been having individually amongst commissioners and the conversations you've been having with the community, that there may be a desire to make some changes to the ordinance other than that. So what I think would be probably the most effective use of our time is to take a look at the sections of the ordinance and see generally what you guys are looking at in terms of changes, allowing us then, if you make changes, to work on those tomorrow and get a draft out to the commission and to the public for consideration, possibly on a Thursday noon or Thursday evening meeting. Now, initially, I had thought maybe a Thursday noon meeting wouldn't be appropriate in that we would have a health board meeting on Thursday, but you have the health board's recommendation. So I think we probably would not need to make another recommendation on the changes that you might make this evening. So if that sounds like a good direction to move forward, that's what we'll do. Okay, so let's take a look at section 1 of the ordinance, and that's the one that pertains to restaurants, coffee houses, bars, breweries, dance clubs, gentlemen's clubs, cafes, all those with alcohol licenses. Those were, permitted to remain open for the drive-through and carry out delivery type services, but not the group setting. And from the discussion that I've heard so far is that there's probably a desire to continue with that practice. But again, like to hear from the commission, of course, on what the thoughts are there, if there's any desire to, how you'd like to proceed with that.
Hey, this is Hoffner. Yeah, I appreciate everyone's efforts, and I also appreciate the health board and all the effort working towards a solution. Now, we should probably explain that if we take no action, the May 1st, which is Friday, or would that be May 2nd or May 1st at midnight, then it just goes back to whatever we had before, correct?
That's correct, Commissioner Hoffner. So there, of course, that is an option. You could do nothing. Then at 11:59, the ordinance would lift, 11:59 on Friday, and Saturday, everything could resume as was before. Now, I did not hear any of that kind of discussion from you all in talking with you all individually, nor did I hear that discussion coming from the community, but that is an option.
Well, my thoughts are that, this is very difficult, obviously, but I'm not for hurrying, hastily, going back to normal. I really believe in the science. I believe what's been done in the research, but I also think that our community has gotten so much more educated. Like some places you can see are pretty busy, but I just believe that from my personal, what I've seen and talking to businesses, and they're going to take measures. I just think that part says that the businesses should help decide their own personal business. And I've already talked to some won't open. Some aren't going to open until the 15th. Some are going to open, but take extra precaution. And I just think that people should get the opportunity to decide. I think we are, as a society, we seem like we get into this game where we have this, we're powering over business, small business, and I just think it kind of takes away their freedom. I'm not saying to put them in a dangerous, I'm encouraging practicing the current CDC guidelines. I'm encouraging that any way we can to have people use practices, and they believe me, anybody head of business that wants to succeed is going to take precautions. So I have a hard time, and I'm not saying that I want business as usual on Saturday. I just want to have the businesses run their own business and do it in a cautious way. And I don't think we can pick and choose, because if we do that, it's going to be a huge fight. While I take extra caution than they do, and so it's hard. If people want their hair done, they just go a few miles out of town and have it done. So I just think that we have intervened in people's lives and their businesses, which okay, that's okay, because we're looking out for the safety of our community. That's what it's about. But I think since we first enacted this 1033, people have changed. People have really paid attention to, hey, what would I do? I interviewed many businesses this last week, and what would you do if May 2nd came and the ordinance dissolved, you got back to normal? What would you do? Well, some businesses won't open. They just don't feel they're safe enough. Some businesses are going to take in, obviously, like Doug alluded to and Mary did earlier today, is that things are different. People will take caution with the clearance and with the 6 foot, the 10 people. Now we could go all day and we could make enact. You can only have 10 people per square foot in your business, and oh my God, you could go on and on about how we could regulate these businesses. And the more we get into it, the more we're trying to be this strong hand. It just doesn't seem right. It just seems right. Now, is it right that businesses wait? Yes, certain businesses should wait, but it's also a time I think we need to back off. That's just my personal opinion, and offer suggestions, offer guidelines, which we do already on our website. People can look at our website and take the necessary precautions. So I really, and I'm not saying this to say that we should go back to normal, but we should leave it up to the individuals, businesses to decide. That's my feeling.
This is Mason. I would like to echo Jake. I see where Jake's coming from, and I'd like to, my input would be to amend what Jake said a little bit, in that, if this is going to this is going to come back multiple times potentially, and we're going to have some sort of new normal where we can't just have businesses closed. So if that means CDC guidelines of 10 people in an establishment, wherever the guideline is, use that as a baseline and then increase from that point forward to a number that works, but also knowing that we might have to come back down to a number if there is a spike or an increase. Could be next fall, next year, sometime. And so I don't see how we can open up down the road and then close everything down again without having some sort of minimum number for all businesses to stay open. And so I would tend to agree with Jake that it's getting to be really hard to close everything down and keep it closed at this time. But I also think we need to reopen everything responsibly, not just back to free reign, open up as normal. And I know, Amy, you were trying to go through the ordinance line by line, but I think that discussion goes to the bigger part of all of the ordinance, not just the first section.
This is Bridget, and I would agree. Sorry. This is Bridget. I would agree with what Mason is saying, and even a lot of what Jake is saying. I would get really comfortable if the only thing we kept of this current ordinance was the last one at the 10 persons rule, and really giving everybody the opportunity to possibly reopen, but think about doing business completely differently than what they've done in the past. And that way we're not picking this business over another, but we're putting an overall guideline into place that they need to figure out, can I effectively do business with a 10-person rule or a 20% capacity rule? I'm not sure what that looks like exactly, but I think that's what I would like to try to get to.
This is Commissioner Mosier, and what I was going to follow up with, which is a good point of a couple businesses I talked to today. I think the 10-person rule is a little bit hard in that some businesses have the capacity for more. If you take a very small, let's say mom and pop business that can seat 15 and you're wall to wall with people and you're saying it's okay, they put 10 in, but then you take a larger facility that seats 100 people and you tell them they can only have 10 in, and you don't even have people within 20 feet of each other if they sat by themselves. I mean, I do see some of the cities using more of a percentage per seat type of rule, so that the business that only can seat 15 and the business that can seat 100 in an economic model puts them a little bit more on a playing field. That might take more research. But I don't think, depending on space, it would be fair to say you can have 10 when some businesses might be the size of a bedroom and some the size of an entire house. So just something to think about, to throw out there.
And Steph, I would, this is Mason. I think, a percent of occupancy that is determined for each business may be a model there. Because you're right, it's hard to be fair based on 10 people if it varies greatly from business size to business size. But anyway, that's just my 2 cents.
I would jump in and say, somewhat in agreement with some of what you guys are saying. I would like to see us acknowledge the city health board's recommendation and use the next 2 weeks to have an open discussion with our businesses about opening in some sort of a coordinated fashion. And it goes kind of to what Steph was just talking about. If you say restaurants are open, there's a huge difference between restaurant with huge floor plan versus, like you said, one the size of a bedroom. And if we're going to expect our employees going to be expected to bring their own PPE, are employers providing PPE? I saw a report this morning from Atlanta. They are reopening restaurants today, and they have 6 person at a table rule. That's a state guideline. Okay, who's enforcing that? These are high school kids that work these tables, right? I would like to see us work together to provide some clearer guidelines, recommendations. I see that Hy-Vee is going to start wearing masks. Employees with Hy-Vee are going to start wearing masks tomorrow. That's a Hy-Vee-wide decision. I worry about opening haphazardly and undoing all of the potential good that we've already done.
Well, and I think, the other thing we're seeing on our agenda tonight are outdoor cafes and seating areas. And I think as we've been seeing, I'm sure all of you have been seeing this past weekend, the number of people out and about. I think sometimes too, there might be a false sense of hope that because I'm outside, I'm safer from getting this. So I can put 6 people or 7 people at a table because and next to each other because I'm out in the open air. So it's not circulating. But tonight on the agenda, we have some outdoor cafes and seating areas. And how do you judge, or can you use the same percentage? I don't know, but it's something to think about.
Pardon me, Mayor, I would ask, it's, getting close to the crossover time for the meeting. So I would ask that you maybe call for an adjournment. We'll continue this discussion when you get to your item on the agenda, but everyone should stay on. We're going to shut this YouTube stream off, start a new one, but you guys don't have to do anything different. You just stay right on the same call, but we're getting about 5 minutes away here, and I want to make sure Dwayne has time to flip things over.
Okay, and then Amy, I would ask if there has been any public comment, emails or anything coming in, is somebody collecting that to then share at our 7 o'clock meeting?
Blaine's collecting what comes in on email. Brad is collecting what's coming in on YouTube chat, and Dave Mingo is collecting on the phone. So you'll be able to hear those.
Well, as promised tonight, we have a lot to discuss, and I'm sure we have a lot of input coming our way. So let's take 5. If I could get a motion to adjourn.
So moved. Mosier.
Second, Schramm.
We have a motion and a second. Al, can you do roll call, please?
Yes, this is roll call to adjourn the work session. We'll start with Sarda.
Sarda, aye.
Sarda is aye. Ferdig.
Ferdig, aye.
Ferdig is aye. Hoffner.
Hoffner, aye.
Hoffner is aye. Minor.
Minor, aye.
Minor is aye. Mosier.
Mosier, aye.
Mosier is aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber, aye.
Weber is aye. Benson.
Aye.
Benson is aye. Mayor Johnson.
Johnson, aye.
Johnson is aye. Motion passes 9-0.
All right, this meeting is adjourned. See you again in a few minutes. Al, could you start us off with roll call, please?
Okay, this is roll call for the 7 o'clock meeting. Benson.
Benson, I.
Benson
Or
is
here.
present. Sarda.
Sarda here.
Sarda is present. Fertig.
Verdict here.
Fertig is present. Hoffner.
Hoffner, present.
Hoffner is present. Minor.
Minor here.
Minor is present. Moser.
Mosier here.
Moser is present. Schramm.
Schramm here.
Schramm is present. Weber.
Weber present.
Weber is present. Mayor Johnson.
Johnson is present.
Mayor Johnson is present. City Manager Leon.
Here.
City Manager Leon is present. City Attorney Denherter.
Denherter here.
City Attorney Denherter is here.
All right, Commission, you have before you the minutes of the regular meeting of April 13th, 2020. What is your pleasure?
This is Sarda. I move we approve the minutes.
Mosier second.
We have a motion and a second. Is there any commission discussion on this item? Al, roll call. Are you there, Al?
I'm sorry, I didn't have my mic. This is roll call on the minutes. Fertig.
Verdict. Aye.
Fertig is aye. Hoffner.
Hoffner, aye.
Hoffner is aye. Minor.
Minor, I.
Minor is aye. Moser.
Mosier, aye.
Moser is aye. Schramm.
Schramm, aye.
Crum is aye. Weber.
Weber's aye.
Weber is aye. Benson.
Benson, aye.
Benson is aye. Sarda.
Sarda, aye.
Sarda is aye. Mayor Johnson.
Johnson, aye.
Mayor Johnson is aye. Motion for the minutes passes 9-0.
City managers report.
Thank you, Mayor. Members of the commission, won't go into very much, just logistics for this meeting unless you have questions for me. If you're not speaking, of course, please mute your mic. We do have a number of opportunities for people to make public comment on the YouTube live stream chat, as well as the email city, which is commission@cityofyankton.org. as well as our phone number, 668-5251. So when the mayor asks for comment, he will ask the staff person manning each of those mediums if there is a comment, and they'll read those or relay those to you. Also, just want to request that if you do make substantial changes going forward with our 1099, that you perhaps consider setting a special meeting for later on in the week to give us some time to recalibrate here. Ross can do his best to keep up with any changes that you have, but just to make sure we can go back and rethink those things and check statutorily if they're significant. We'll see where that discussion goes. Are there any questions for me? Otherwise, I'll just let you move on with your business. Okay, thank you.
Now's the time for public appearances. This is a time when anyone can address the commission about an item not on tonight's agenda. Dave, is there any telephone input?
We have no comments via phone at this time.
Brad, any commentary on YouTube?
There are no YouTube comments that aren't related to a later agenda item.
And Colleen, any emails? Are you there, Colleen? All right, well, we'll move on, and if Colleen has something for us, we'll let her chime in. Moving on to the consent item agenda. Number 1 is consideration of memorandum 20-84, recommending approval of the application from the Meridian District for a transient merchant license for May 1st to October 31st, 2020. What is your pleasure?
So moved.
Second, Benson.
We have a motion and a second. Is there any discussion on this item?
Does anybody know, will this be tied to what's determined with our ordinance, or does this market move forward, ordinance or not?
Amy, we need your.
Sorry, that's something I should have talked about maybe in my city manager's report. So any of our items that are pertaining to special events, or transient merchants, things like that, we're working with all those folks because we just don't know what the future is going to bring. So if there's something that comes up, we are putting it forward to you all with the caveat that, look, depending upon what happens with numbers and with COVID-19, we may or may not have to, cancel an event, or you might have to run your event substantially differently, or all those types of things. And some folks are telling us, I want the permit, but I may not end up doing the event just for my own, our own choice. Or so we're working with, short answer to that is we're working with all of them independently, because all the events, of course, are different as well.
And remind me again, is this the same parking lot as last year?
I believe it is. And this is, the outdoor market. So they have a little more flexibility maybe than some of our other special events that would be inside. So they can do a little more than some of our others.
Any more commission discussion? Dave, any telephone input?
No telephone input on this issue.
Brad, any YouTube commentary?
None on this issue.
And Clean, any email input? Okay, hearing nothing, Al, let's do roll call, please. Al, is your mic on?
Sorry, I keep forgetting that. At least I'm not leaving it on. Okay, once again, this is roll call on the consent item 2.1, which is a transient merchant license for the Meridian District. Hoffner.
Hoffner, aye.
Hoffner is aye. Minor.
Minor, aye.
Minor is aye. Mosier.
Mosier, aye.
Mosier is aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber's aye.
Weber is aye. Benson.
Benson, aye.
Benson is aye. Sarda.
Sarda, aye.
Sarda is aye. Fertig.
Fertig, aye.
Fertig is aye. And Mayor Johnson.
Johnson is aye.
Johnson is aye. Consent item 2.1 passes 9-0.
Number 2 on the consent item agenda is consideration memorandum 20-86, recommending approval of the applications from Yankton Ribfest Committee for a transient merchant license for June 13th, as well as a special events dance license for June 13th. What is your pleasure?
Mosier moves the
Benson.
memorandum.
Benson seconds.
We have a motion and a second. Is there any commission discussion on this item? Dave, any phone input?
No phone input on this item.
Brad, any YouTube input?
No YouTube input on this item.
And Clean, any email input? Still nothing. Okay.
No input.
Oh, there you go. Thanks, Clean. Al, roll call, please.
Okay, I'll turn my mic on again. Consent item 2.2, which
hear
is
you.
transient merchant special events dance license for Yankton Rib Fest. Minor.
Minor, aye.
Minor is aye. Mosier.
Mosier, aye.
Mosier is aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber's aye.
Weber is aye. Benson.
Benson, aye.
Benson is aye. Sarda.
Sarda, aye.
Sarda is aye. Fertig.
Fertig, aye.
Fertig is aye. Hoffner.
Hoffner, aye.
Hoffner is aye. Mayor Johnson.
Johnson is aye.
Johnson is aye. Consent item 2.2 passes 9-0.
All right, now we're on to old business. And number 1 is consideration of memorandum 20-85 regarding the special events on sale liquor license for June 13th from Rock and Rumble doing business as Yankton Rib Fest. And that will be the block of 3rd Street between Cedar and Walnut plus half of Walnut to the alley and a half a block north and south on Walnut and 3rd Street. What is your pleasure?
Benson, so moved.
Sarda, second.
We have a motion and a second. Is there any commission discussion on this item? Dave, any telephone input?
None on this item.
Brad, any YouTube input?
None on this item.
And Clean, any email input? And I understand Clean may be having some difficulties, so Amy will let us know if there's any email input if we're unable to hear Clean. So with that, Al, roll call, please.
Okay, and this is roll call on old business 3.1. Mosier.
Mosier, aye.
Mosier is aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber's aye.
Weber is aye. Benson.
Benson, aye.
Benson is aye. Sarda.
Sarda, aye.
Sarda is aye. Fertig.
Fertig, aye.
Fertig is aye. Hoffner?
Hoffner, aye.
Hoffner is aye. Minor?
Minor, aye.
Minor is aye. And Mayor Johnson?
Johnson is aye.
Johnson is aye. Old business item number 3-1 passes 9-0.
Moving on to new business. Number 1 is consideration of memorandum 20-87 and resolution 20-27 regarding a request by Rock and Rumble for special events parking ordinance number 933 to be in place during the Rock and Rumble on June 13th and a suspension of our alcohol consumption laws. What is your pleasure?
Hoffner
move.
moves. 2087.
Did you get that, Al?
You can give me the second too. This is Mosier, that's fine.
All right, we have a motion and a second. Any commission discussion on this item?
Maybe just a point of clarification. In the memorandum, it says that they've been unable to collect signatures due to COVID-19 pandemic. Is that anything that should hold up the vote, or are we okay to move forward without signatures?
That's up to the commission. You know, this is an event that you've had before previously. And I know that the organizers will call folks. I think if it were a new event, I'd be concerned about that, but beans is something that's been happened before. My recommendation would be if you're inclined to approve that, then to do so, and I follow up with the organizers and make sure that they contact the people by phone.
Thank you for clarifying. I just wanted to make sure that wasn't anything that we couldn't do.
Any more commission discussion? Dave, any phone input?
None on this issue.
Brad, any YouTube input?
None on this item.
And Colleen, any email input?
I don't believe there's
I guess-
input.
Okay. Al, roll call, please.
And this is roll call on new business item 4-1. Schramm?
Schramm, aye.
Schramm is aye. Weber?
Weber, aye.
Weber is aye. Benson?
Benson, aye.
Benson is aye. Sarda?
Sarda, aye.
Sarda is aye. Fertig?
Fertig, aye.
Fertig is aye. Hoffner?
Hoffner, aye.
Hoffner is aye. Minor?
Minor, aye.
Minor is aye. Mosier?
Mosier, aye.
Mosier is aye. Mayor Johnson?
Johnson is aye.
Mayor Johnson is aye. New business item 4-1 passes 9-0.
Number 2 under new business is consideration of memorandum 20-73 regarding a sidewalk cafe license for the Walnut Tavern at 100 East 3rd Street. What is your pleasure?
So moved, Sarda.
Minor, second.
We've got a motion and a second. Is there any commission discussion on this item? Dave, any phone input?
None on this item.
Brad, any YouTube input?
None on this item.
And Colleen, any email input?
She did not forward me any email input, so I believe there's not.
Okay, roll call.
Okay, and this is roll call on item new business 4-2. Weber?
Weber, aye.
Weber is aye. Benson?
Benson, aye.
Benson is aye. Sarda?
Sarda, aye.
Sarda is aye. Fertig?
Fertig, aye.
Fertig is aye. Hoffner?
Hoffner, aye.
Hoffner is aye. Minor?
Minor, aye.
Minor is aye. Mosier?
Mosier, aye.
Mosier is aye. Schramm?
Schramm, aye.
Schramm is aye. Mayor Johnson?
Johnson is an aye.
Johnson is aye. New business item 4-2 passes 9-0.
All right, number 3 under new business is consideration of memorandum 20-88 regarding recommendation by the City Health Board regarding an amendment to ordinance number 1033, which is temporary business closure during the COVID-19 pandemic. And for those in the audience who may just be tuning in, we had a study session the hour prior to the beginning of the regular commission meeting where we began a discussion of this ordinance. So City Manager Amy Leon, maybe you can reiterate what the City Health Board recommendation is, and we can pick up our discussion from there.
Sure thing. Health Board recommendation is to expand, meaning extend the length of the ordinance 2 weeks until May 15th, reconsidering it at your May 11th regular City Commission meeting. However, omitting the businesses of dog grooming, pet grooming, as well as tanning salons, with the caveat that those types of businesses allowed to reopen would be able to do so using CDC and OSHA guidelines set forth for safe practices for businesses. So that's the recommendation of the Health Board at this time.
And so where we were at the end of the study session is we were considering going through the ordinance as it is and making any changes that commissioners wanted. However, we hadn't quite gotten that far. We were having more general discussion about the future of the ordinance. So we had quite a bit of input on that. I don't know if commissioners want to pick up on that thread and continue discussing the ordinance overall. If you want to start going through the ordinance, starting with section 1, which is where we left off.
I'd like to start, Mayor, Commissioner Hoffner here. I'd like to reiterate what I talked about in the work study session. And again, I want to thank the Health Board and all the professionals that have spoken to the Health Board in the last few weeks. I really do value their opinion, and what I'm saying is nothing at all against that. But it's about businesses deciding their own future with their own practices. As I said earlier, there's many businesses that I talk to that aren't going to open. See, but I think it should be their choice. I believe me, I hear you. I hear the recommendations, and I'm not discounting that at all. But I think these businesses have been educated on this issue, and they want to take practices. I mean, we have businesses that are packed with people right now, different businesses that are closed. But I just think it's time that we let the businesses decide. Some won't open, and guess what? Some know they're going to open, and people won't patronize them. You know, just because there's a certain establishment open doesn't mean that I'm going to run out, go to it. So people are making choices. They've gotten educated thanks to all the professional advice. We have websites in the state. We have precautionary measures. We have good guidelines right on our city website, and we continue to update them. I think we should spend a lot of time on educating and giving examples and urging caution, and just constantly be there to help these businesses slowly get back in the door. Some, like I said, won't open. Some will open on Saturday and be really careful. And that's my 2 cents again. Sorry I went on again, but that's how I feel.
This is Weber here. Can somebody speak to what happens if we lift the restrictions and if that limits people's ability to get unemployment benefits? Can anybody talk about that?
No, we don't, that's a state-driven program, so that's up to the state. I presume if their business is closed by their own, by the proprietor's own decision, that they still qualify. Qualify doesn't always mean that they're going to receive. unemployment, is my understanding. So those decisions are made with the Department of Labor. The city has nothing to do with those decisions. You know, I'm not exactly sure. There is some ability, I believe, for self-employed people now to access unemployment, depending upon how they're classified. Now, whether or not they'll choose to reopen or they choose to stay closed, that would be a discussion between them and the Department of Labor. And that maybe isn't a very satisfying answer, but you know, that's as it stands now as well. So we do have some businesses, our dentist office, for example, they can operate right now under your current ordinance, but I believe they've collectively chosen not to. Now, whether they qualify for either unemployment or the payroll loans, that's between them and the state at this time.
Thanks, Amy.
This is Commissioner Sarda. If I can walk through, first, my thought is, we're talking a lot about businesses and opening and the changes they can make, but it's still, the people still have a choice. If the businesses do open, we've got enough guidelines in place that I don't have to go into these businesses. I protect myself. So let's not forget that people do make choices no matter what we do. So Amy, a kind of general question, if we do decide this ordinance does not pass and we want to do another one, could you go through that timeline? Because the businesses, if we don't pass it, could open, the May 1st at midnight. But if we were to have direct staff to draft a new one and expedite it, when could that new one go into effect?
Sure. Well, an entirely new ordinance, we'd have to know what it is you'd like to have that ordinance say. But an entirely new ordinance, we could draft. We put a first reading at either an established special meeting. So you could establish a special meeting, and as early as you established it tonight, you could do that as early as tomorrow night or Wednesday morning. But we would need some time to draft the ordinance, so we wouldn't prefer that. But you could hold a first reading right away, and then under these sort of emergency provisions, you could have the second reading within 5 calendar days. It's only effective upon publication. We'd work with the media, with the Press and Dakota on publication date. In this circumstance, they've been really good to work with in terms of publishing right away. How long it would take us to write the ordinance would kind of depend upon the parameters with what you would like that to say. But it is possible within a week's time to get an ordinance in place. I think the preferable calendar would be to give us, the parameters of what you want an ordinance to say, to have your regular, to have a special meeting for a first reading, and then give us time to work on that language if necessary, and maybe at your next regular meeting have a second reading. That allows more time for public input as well, but you could foreseeably do it within 7 days.
So if I throw that date out like the 11th, we could, if we gave clear direction and we followed all the rules we had to for first reading, second reading, and publishing, the 11th would be could be a possibility.
Yeah. Yes. Sure. If you. Yes.
Okay, so this is Commissioner Mosier. Could I take that one step further? What happens then between the 2nd and the 11th? What do people follow?
I'd recommend that they follow the CDC guidelines. Your resolution is an advisory, so that, it's all just recommendations, best practices. Yeah, it would just be, we would work with businesses, of course, that called us, and that's what we're doing now. Even the ordinance you have now isn't really a one size fits all. We've had people say, well, can we do church outside? Here's what we're thinking. We've worked with people on things, various things. I just used church by means of an example, but we've worked with people on various things. So we would work with them if they had questions and give our opinions, but they wouldn't be placed into the code. I mean, they wouldn't be enforceable by any stretch of the imagination.
So then go ahead, Ross.
My thought on that is, if you're going to put together some sort of an ordinance that provides a framework or parameters you would like businesses to follow if and when they start doing business again, I would caution you to, at least by resolution, continue what we have until that would become effective, so we don't have this donut hole problem. I think it's potentially very confusing for the property owners to understand, or have this period of time where they're subject to no regulation, and then all of a sudden have some regulation again. It just seems a little illogical. Another thing that I'd recommend is, if all you're doing is peeling certain businesses out of the ordinance we have now, or adding exceptions or additions to those businesses regulated by the 10-person rule, we can do those changes just by a resolution. That doesn't require a new ordinance. So to the extent that we can keep within the framework of what we have, we take some of these logistical issues off the table. But we can work with whatever this commission directs.
Okay,
The other
that
thing
was,
that
that was my
Sorry.
next question, is what would be better? And that does make sense, because then we wouldn't have a roughly week for a kind of a free-for-all, I guess.
The other thing the commission can do is, prescribe the state's, the governor's executive order. Now, from what I heard today, that's going to change tomorrow, or executive order. But, if your ordinance isn't in place, that would be the remaining guidance that was given to businesses. Now, I don't believe she has a lot of enforceability in that document, but that, would be something we'd point to as what's been guided. You could pass that via ordinance as well. Some cities, I think Pierre did something like that, where they passed her executive order via ordinance. That's an option to you as well. Didn't put that forward because my understanding was you were all interested in keeping what you have somewhat intact, but that's an option too.
This is Commissioner Mosier. Related to that, Amy, I don't know if anybody from YPD is on our meeting, or if you can comment. I am curious what they're seeing out there with the current ordinance we have in place. Only because I just wonder, as we move forward in whatever capacity we move forward in, what this does to our police department. So that would be my first question, is if there's anybody, you or anybody, that can kind of share what they're seeing. I think we can all agree we've definitely seen violations and non-following, even with an ordinance. So I'm just curious what they're seeing out there.
Yeah, I spoke with Commander Foote today. He's a member of our health board. By and large, folks have done a great job, and they've done a lot of great communication with our staff, either asking permission or describing types of things they want to do, and then us working through them, or just saying, yeah, it doesn't sound like that's going to work under our ordinance. So folks have been pretty good. But there are people certainly who have violated the ordinance on an individual basis, or perhaps even businesses that we might not know of, but we haven't issued any citations. Let's put forward it that way. Chief Harris has indicated that most folks are doing great with it, and they're adjusting and somewhat going through a learning process. One thing we have talked about with the police department, as well as code enforcement, is the more, as you lift restrictions, the more detailed those requirements are, the more difficult it is for us to enforce and for us to follow. So we do not have the capability to go through and check, for example, if each business has gloves on, or each business has, on an ongoing basis. That would be, if that was in an ordinance, it would probably be violation, based on violations, where we would perform enforcement, or if it's something we happened upon, but we just don't really have that kind of staff. We learned through this process that it's all we can do to manage to educate on what is in place. So that would be difficult as well. But overall, I've been pretty pleased with, and so has the police department, with people's ability, maybe not to like what's in place, but to comply and work with us.
Well, I'm happy to hear that. None of us put citations in place so that we made money. So I am absolutely ecstatic to hear that Yankton is paying attention and doing what they need to do. That makes me happy. I see Commissioner Minor has her mic on, so if she did, it might be in relation to this before I switch and ask another question.
Oh, go ahead.
Oh, okay. The other thing, only because I know at some point we will be opening this up to the floodgates of what I assume Dave and Brad and Colleen have been collecting. So one of the things I want to bring up in this meeting that I brought up in the last meeting, there was a conversation about, if we would just follow CDC guidelines, and CDC guidelines right now is 10 people per establishment. And to just maybe keep in mind the differences in square footage. Amy, I guess maybe a question to follow up there. If we're talking about potentially doing a per person, per square feet of building capacity, is that something the fire marshal or maybe Dave Mingo can state? Who then, if we would move forward with something like that, sets potentially what those parameters would be? I guess I'm thinking, fire code has to know how many people can be in a building, or is that code enforcement, or where would that be if we looked at something like that?
Yeah, that's where I would start. Although it's not just it's a form and function. So to me, that's where we would start discussions as a staff to if you wanted to go with a capacity. However, depending upon what folks are doing, so a capacity in a restaurant would be different maybe than percentage of capacity in a different business, depending upon what's being done or the service that they're providing. So I guess it wouldn't be an exact science, but that would maybe be a good launching point. From our perspective as a staff, just generally, so the commission knows, the general perspective that we have is that if you're, doing your soft openings, that you do exactly what Commissioner Hoffner spoke to, and that would be, educate them on what the guidelines are out there available for their type of business and try to work with them there. I've heard capacities in some communities. I've heard number of tables for restaurants, and if we get into different regulations for different types of businesses, that's really difficult too. So if you did a different percentage of capacity for a bar versus a restaurant, that would be a difficult thing to balance. So as we're lightening restrictions as a staff, we recommend a little less guidance from the city as opposed to more, just by means of it being not just form, but also what's happening in that business. Video lottery would be another example of that, because a percentage of capacity could be still in a really small area.
Can I jump in with a little commentary? I'm a little bit concerned about, there's a lot of talk about May 1st opening, and all of the conversation that's occurring feels really haphazard to me if we would let that happen. And I'm not sure why we would have been so painstakingly cautious up until this moment, just to throw caution to the wind. Doug Ekron just talked to us about the various curves that we could anticipate. I would love to see us take the next 2 weeks, take the health board's recommendation and strategize with business owners. The governor's going to have an announcement tomorrow, perhaps providing guidelines. I told you in the work session, Georgia has a state guideline, no more than 6 people at a table. I understand guidelines we don't want to overdo the guidelines. But if we suddenly say, all right, businesses can be open on May 1st, one of the huge challenges that the healthcare system has been facing around the country is a resource shortage. How are you going to provide resources for your employees? How are you going to, if we're going to have salon hairstylists wear PPE and require it for their customers, where does that come from? And how do we get it by Saturday? I'm very concerned that we have been so cautious and we have been so good. And the first two guidelines, the federal guidelines for reopening, indicate that you should have a downward or steady decline of cases, which we don't have. And the second one is that we should have widespread testing, which Doug told us we don't have. So it's a measure twice, cut once, right? We get to do this one time. We get to open up once. And I feel like if we're cautious now, it gives us a chance to have a summer. But I feel like if we jump the gun and welcome the surge, then all of our hard work has been for naught. My 2 cents.
Commissioner Minor, I agree with some of what you're saying. Part of it is those we're not talking, speaking for myself, not looking for a complete open all the doors business as usual. If there was a way to follow the CDC guidelines and people and businesses can make that work, then I don't think it would be a huge mass amount. If I'll pick on one, say if we're opening the tanning salons, how many people are we really talking about per day, right? There's still a pretty good small number. It's not going to be thousands of people, right? It's going to be a small number that would go to these places because a lot of people have just adapted a lifestyle that, no, I'm not going out, I'm staying home, I'm following these guidelines. And I think it'll be a small amount of people that will, if we lighten it a little bit, that will be using those services. I don't think it's going to be a free-for-all.
And I'll just follow, I hear what you're saying, and especially with a business like that, where it's small numbers. But for example, let's say you're the restaurant and you ask your employees to bring in their own self-made masks. Well, Mr. Ekren just told us that you need to take those home and wash them before you wear them again the next day. Do we launder those at the restaurant? Do we trust the employees to do that? I feel like our businesses in town need to discuss the details. If we have, for example, like Georgia has 6 people at a table, well, what do you do if there's a table and 2 more people come in and there are 8? Where I feel like Yankton has been pretty unified as we've moved through this together, and I think we're asking for trouble when we're letting businesses just do whatever. If this business requires N95 mask, this business requires a bandana, etc. I just feel like we have been so cautious, and it's actually alarming to me to think that we would just reopen without having a strategy.
I hear what you're saying, Commissioner Minor. I guess, I balance this, and I've said too, there's obviously physical health, there's emotional health, there is economical health. I think, and I said this earlier today, we all on the city commission sit in a very nice spot because we have jobs and we're getting paid. We have a large chunk of Yankton that has not been afforded that possibility. They're not getting the resources. We as a commission are telling them they have no income. And if we don't try to see if there's a way that we can meet the economical health of our community by allowing them to put safety precautions in their business and try to be open, I worry a little bit about that and what happens to businesses in our community. I'm not saying I don't want to sacrifice one individual in our community for economic health, because I do think it's a three-pronged approach, almost like a stool that has three legs. How do we balance all three of those legs so we don't teeter one way or the other, and maybe regret what we're doing? But you know, I also really worry about, as a community, do we have the food resources, the housing resources, and all of that to help our community members that have no choice to work right now? And that's a big struggle for me as to how we balance that tripod.
Steph, I would agree with a lot of what Steph has said, but I think the things we have to continue to keep in mind is I pulled up the labor report from YPG earlier today, just to confirm what I was thinking. And I am seeing that the majority of Yankton, those that are employed here in Yankton, are still working. So what does that mean? That means there's still a ton of opportunity for people to have infection, or be exposed. You also still have everyone shopping at big box stores within the community. So the ones that we are really hurting in this process are privately owned businesses. And what we've focused on as a commission for years now, the last handful of years, has been quality of life. And ideally, we want to set these people up, these businesses up, to be able to continue to run after COVID-19 is gone. And what we're told right now is that we might be in this for the long haul, whether it's we may not hit peak until beginning of July, and then we're still starting to decline from there, but then we could have a spike in the future as well. We don't know what this looks like. And so I think over the last 30 days, a lot of our businesses have been proactive. They've been coming up with plans of how they could operate if they could resume business on May 2nd. And we've seen that from gyms who have reached out to us and told us, here's what we can do. We've seen that from salons. I think we have to give our businesses the opportunity to reopen and prosper. The other thing is too, it's like we keep hearing, camping season is well underway. Fishing season, well underway. We have people coming from all over the state and other states into our community, but we're not going to let some of our own businesses within our community make a living, even though there's so many other opportunities for infection. So I think we really just have to take a lot of the items into consideration.
I totally hear what you're saying. And I think we're just coming at it from two different angles. I feel like there's this kind of binary approach that you either are worried about health and well-being, or you're worried about economic well-being, and they are hand in hand, right? And that's the balance that Steph is talking about as we move forward. I would love to see Yankton have a prosperous summer. We all would. Everybody on this Zoom call wants the health and well-being of our citizens, as well as the economic well-being of our businesses in town. That's why I would argue that it would be, I think, in the best interests of everyone to have a strategy moving forward. I know that there are businesses that have plans. Do they have the resources? I don't know how many servers there are at a large restaurant in town. Are they changing gloves between every person served? Are they, I don't know what that looks like. And I think there has been strategic discussion. I would like to see us nail that down before we would open. I think in what you're talking about, both Commissioner Benson and Commissioner Rozier, is that balance. It's an ounce of prevention is worth a pound of cure. Make sure we not only have the plan in place, but we have the resources, and that people understand this is how business is going to operate. If somebody comes in and doesn't have a mask, this is what we do. I would like to see us make those decisions before they're problematic, given how cautious we've been up until this point.
This is Commissioner Fertig. As most of you know, I've been pro-business about this pretty much from the beginning. That being said, health of our citizens is another top priority. I personally would not be, I'm not particularly comfortable with just letting the ordinance expire completely and starting over and seeing what happens. I would definitely be for expanding on what the health board has suggested with maybe some smaller businesses, but larger places where, you know, large groups gather, where you're not only talking about infecting a person or 2 people or 3 people, a group, you know, a group of people, that's still awful concerning for me, especially being this early into it where our numbers are rising. I do believe that our numbers are low enough that maybe even some of these extra businesses shouldn't have been on there to begin with. And I would have to disagree with the all or nothing notion. I think it's important, and I think it's our duty to go through and, you know, and address these business types one by one if we have to see, you know, which ones can affect us, can affect it more often than not, or have more of a chance of spread than not. You know, I'm definitely for business. I want to get as many of these small businesses open as soon as possible. But it's the balance between, you know, health and prosperity. I mean, that's a fine line. I don't know if nobody has the answer. But I would be very hard. It would be a hard decision to just completely wipe this ordinance off the books.
Yeah.
Commissioner Weber here. If you just, you know, I'm glad that we can have this discussion, and there's so much that goes into it, and I can appreciate what everybody has shared so far. From my perspective, I do want to bring up the fact that I'm closely connected to the Yankton County EMS, and I'm also the chaplain for the fire department and the police department. And we got to think about our first responders who have the potential to get exposed to this at any point. And we have to think about that infrastructure that we have in this community. In the health board meeting this afternoon, Dr. Piatla said that there were 8 intubations in Sioux City yesterday. And I don't say that to sound alarmist, because I know that we do have to, we need to prepare, and we need to give the community a chance to function. But we got to think about our first responders too, and I just wanted to put that out there.
I would just follow up on that, Commissioner Weber. So it feels to me like if you are a business, a restaurant, and there are people coming in to camp and stay at the lake or visit family, I would rest easier knowing that our restaurants, our businesses have a strategy and a plan to move forward, keeping not only the patrons safe, but the workers safe as well. And I think something to consider with the pro-business, gosh, we want them open. Yes, we want them open. But I don't want Yankton to open and have what's going on in Sioux Falls, where you open up the paper and there's a list of if you went to this business last week and if you went to this business last week. Talk about harming the business community. Nobody wants that for a business either. So I would really urge us to consider keeping the health board recommendation in place for 2 weeks while we get this squared away. Let's hear from the governor tomorrow. Let's see if she has any guidelines for how we do this. All the medical professionals that have spoken to the city health board and have spoken to us tonight have said, give us a little more time. So they're the ones on the front line, and I think we have to take what they say to heart.
So I would follow it up. This is Commissioner Mosier with just a few things. I keep jotting notes down because I'm afraid I'm going to forget them in my old age here. But, I think right now what we're seeing, and I guess I would ask that we weigh this. I don't necessarily have a right answer, but I know for a fact there have been people that have drove to Sioux Falls to go to a restaurant that still has limited seating. They have went to other communities to restaurants that are still open in some capacity. They've went to get services that we have closed. And I guess I wonder, how safe are we keeping our community, allowing them to go to a community that we have no idea what their regulations are? I know for a fact there are people operating out of their home instead of their business as a way to make ends meet. And would it be safer to at least have them in their business where they have more supplies they need to do that? I mean, I guess I just throw that out there to kind of weigh it down. I mean, one of the businesses I took a call from today said this Thursday will be 5 weeks that they've had their doors closed and they can't sustain at this pace and have any vision of being open if we continue to keep them closed with no opportunity to try to figure out how they can do some things. I saw a good statement, if you're looking at 5 weeks, that has been 5 weeks that we've allowed people to try to, especially in our medical community. I'm not saying it's perfect, and I'm not saying that we have, that we're ready to go should something hit, but that's been 5 weeks also that the medical community has been able to prepare for what could come, which is, exactly what we saw from Doug tonight in predicting, if we keep things as far as like what the CDC is recommending in place and things like that. So I would just ask too, that we also weigh us having our citizens go to other communities to get what they feel they need versus keeping them here with regulations. At least we know what's going on. And the same too, Commissioner Minor, I would agree. The state parks are open. So we're going to have people coming from who knows where with who knows what sort of guidelines. And if we can prepare our businesses to be ready for that and to have a plan in place, maybe that helps our community as well.
So to kind of build on maybe what Commissioner Furtick said, if we went through this ordinance one by one, if we looked at it in a way that a business, if they're more of a one-on-one business, if you have the person providing the service to their customer, that's a one-on-one business. Or the health club, where you don't have people mingling with each other. A person goes there for a treadmill, they work out, that treadmill's cleaned after they get off it. Some businesses like that, we could work through this ordinance and pick those businesses and say, yes, okay, a soft opening, we could amend this ordinance to open those businesses. But the businesses that large groups can get together in, we would not open them, and we have till the 11th to work on those. But I would like to see us go through it and agree upon opening the one-on-one businesses.
Can I ask a question of the health board? Did you guys go through, I didn't see the meeting today, I apologize, I was in a class with students. Did you guys go through, how did you come to decide dog grooming and tanning salons?
Dog grooming and tanning salons were never part of our recommendation, so we didn't feel initially that those were necessary inclusions. So that's where we came upon that. The others we didn't go through based on today, based on what we've been talking about for the last couple of weeks. We've had comment and discussion throughout the last couple of weeks where this has been in place, and we've been meeting twice a week, and we've been talking with, other health experts, but also looking through information. We haven't seen anything that would say we would meet any criteria so far put forward that would, I guess, affirm, give us a good sense that we should open up. So that's where those two came from. Other than that, we've been our recommendation has really been holding things in place. But we have been discussing, because we have been getting the emails from, particularly salon owners, who were, questioning that recommendation.
I'd like to make a comment if I might. One of the things that we discussed, and certainly I totally agree, this is a really tough choice to make. And from the health board point, what we tried to do is put forth what we felt was probably medical best practice, and kind of left it up to the city commission then to add the economic balance to this, which is so difficult. We brought in a number of medical experts to give us some extra information, both in the local as well as the state picture. And so we did hear from Dr. Basil, we heard from Dr. Specker, we did hear from Dr. Paetala, and we heard from Doug Ekron. And some of what I was taking from that was it was not always just the absolute number. And in fact, I did ask Dr. Specker, who is a PhD epidemiologist from SDSU, the specific question about the risk of salons, because it is just one-on-one. Her opinion was that was you can't do it at 6 feet. It is close contact for a period of time. And she left that one in a higher risk category. That anyway, that it has to be more based partly on distancing, not just on numbers. So I think if we just pick a magic number of 10 or whatever, we maybe are missing the point of what the epidemiologist was telling us. So.
And Dr. Miller, I understand that. So, but what if them people that are performing that one-on-one, whether it be a salon or a tanning facility, if they have all the appropriate PPE on and they're washing their hands or wiping everything off, they've got the mask and everything. Obviously the person maybe getting their hair done couldn't be wearing a mask, but what if they followed all those precautions? Wouldn't that put them in a place?
I think that the concern, of course, is the risk of infecting the stylist. And part of that is, and also one thing is right now we don't have an ample supply of true PPEs. So that person, you would probably want to mask the client and the salon operator. But when you wear not a true PPE, it doesn't really protect you. It protects you from infecting others. So the risk would be, even if we had the salon operator wearing a bandana or a homemade mask or whatever, because right now we don't have ample PPE to give a true mask to every salon operator, who would have to change it between customers. You can't just go and wear one all day. That person, the salon operator, if she's wearing a mask, probably would not infect her client. But if that was an infected client, she could become infected. And then as she went and saw her other clients, there would be a risk there. So I believe that's where the epidemiologist was coming from, in that is, and looking at some of the places where we've had outbreaks, it has usually been close. They kind of mentioned shoulder to shoulder. Well, that's kind of the salon, over a period of time. So if you're getting your hair done, you're getting a perm, you're getting a highlight, it's close contact for a period of time. If we had widespread testing, so we knew people were negative, we had adequate PPE, that might be a completely different story. But just going by what the recommendation from the epidemiologist was and what Dr. Basil said, Dr. Paetala, Doug Ekron, we're not there yet in our supplies and our precautions to keep our people safe. So that's a lot of what we based our recommendation on, is that we weren't there yet. We probably haven't reached our peak. We're not steady or going down. And that by, I guess our recommendation for the 2 weeks was that we would work on a very set plan on, if things look good, how will we exactly phase this in? So we're not doing it hit and miss, that we actually have a definite phase in plan. So that was our thought. We had fear of seeing it just expire at midnight on the 1st. So just feeling that maybe we weren't quite ready at that point.
Thank you. And I just want to follow up. That's I've probably said it 5 times. I'll say it one more time. I'm really concerned. I know there are businesses that have plans. I'm worried about the resources. How do you get the PPE, the gloves, the masks that are appropriate for whatever the type of business is, the cleaning equipment, et cetera? How do we get that in their hands quickly? I would love to see us continue to be cautious and not only make sure businesses have plans, but make sure they have resources.
I think our concern too was that it has been felt that in many places that have looked at it, as many as 50% of people are asymptomatic carriers. That could be the person sitting in your salon chair, and you would never know until you got sick. And a bandana mask will not protect you from that person. That was just our worry, that we don't have the supplies, nor do we want to use up the supplies to not have them available to our first responders, to our medical personnel, knowing that the statistics come out that being a medical person, a doctor, a nurse, a caregiver in some way, directly in contact with that patient, has about a 30% risk of getting sick themselves. And in any of the calculations that AVER is doing, they're thinking as much as 30% of their workforce could be out. So it isn't just the supplies like the masks. We might be missing nurses and physicians and EMTs and police and other people too. And that's a big, important part of our infrastructure.
I'm sorry. One more time. I did watch the playback of the discussion with the epidemiologist, and she played all of the old slides and compared as much as you can the current pandemic to what happened with the Spanish flu. And she said if there's one lesson to learn, it's not to open up too quickly. The places that opened up too quickly suffered more loss of human life 100 years ago with a vastly different landscape, medicine, et cetera. But that is sitting right there in my brain.
I think one gift we've talked about often in our discussions is the gift of time, in that South Dakota, the virus has been slower getting here. It's been slower spreading here. And now you can see this as a gift or a curse, that we have time on this end of it, so we can see what other places are doing to reopen. We're still very much in the early stages of people figuring that out. So we can use that time, as Amy and some of the others have said, to really strategize a little more, see what the governor has planned for us, and try to do this right. Others may see that as a curse because it would be a few more weeks of businesses maybe being shut down. And I have a lot of empathy for them and concern about their well-being too. And am not doing this because I have the power to. It's because being on the health board, the messages we've heard from the public health official or from health experts has been pretty unified. There hasn't been any dissenting opinions. They think we need to take this slowly. We need to think carefully about it. If you look to our north in Sioux Falls, they've had an explosion of cases. You look to the east, Sioux City has an explosion of cases. You look to the south, Madison, Grand Island, they have an explosion of cases. It's true that a lot of those cases seem to be tied to meat packing plants. We hope that that doesn't come to be the case here, but with that much of the virus around us, I think it's naive to think it's not going to come here and spread and eventually show itself. So I think we need to use this gift we've been given of time, use it wisely, not go too fast. And my concern is that this is not a one-time and we're done thing. We're gonna have to figure on ramps and off ramps, because the chances are, while coronavirus is not the flu, it does act a lot like past flu pandemics. And if that is indeed the case, we can expect a perhaps even larger peak in the fall. I think that's something we need to be ready for, even though we don't know if that's going to happen now. And with each week, we're learning more about this virus, what it does. I mean, what it does to the body is becoming more scary, I think, the more we learn about it. But it's time to be cautious about this on-ramp, because once we get back on, people are not going to want to get off. And so I think if we don't consider what the signposts are, what measures need to be in place to get on, it's going to make it even more difficult to get off, because people are going to say, well, you didn't base it on any stipulations last time. You just felt that it had been closed too long, and the economic risk was greater than the health risk. I think is kind of where we're getting here, which I understand. And I sit here and I sympathize with a lot of the arguments being made. I've just been in knots about this meeting for the last week, trying to decide how I would vote. And so my hope is that we would give ourselves a couple more weeks to even reopen the one-on-one service businesses, even though I'm, like most people here seem to be, I really want to get them back operating and on their feet. That's where I'm landing right now.
Hey, Commissioner Hoffner here again. Yeah, all good comments. It goes back to, if we're going to compare to Sioux Falls or to our southern neighbors, then why are we not closing meatpacking plants? We need to expand. If we really want to stop this thing and we're serious about it, we'd expand the closures. We just targeted a few that we thought would be there, but obviously other cities are not closing the establishments that we are. I just think that we gotta go back to education and the people that support these businesses and their own perspective as far as what they can do and their guidelines. But hey, yeah, if we want to believe me, I said before, I agree with all the science. There's no doubt. But we also have to, put some trust in the people to do this. And if you really want to stop this completely, yeah, we can do it. We don't come to a screeching halt, all of our businesses, and we have to expand it. Another thing, I'd like to know if I had the statistics of how many people in this community came out to our larger retail stores. Thousands of people, parking lots full. Compared that to if our businesses that we closed down were patronized in a small way, just to with the social distancing and everything. If you had those numbers, we'd probably be say, wow, just some thoughts.
So, yeah, question then. So on this ordinance, can I make a motion to amend it, or do we have to vote on it as it's written? If that makes sense.
I wouldn't expect a vote of any sort this evening. I think we're really just looking at, assuming this commission is agreeable to a special meeting later in the week, I think we're just looking for direction as to what this commission wants so that we've got some time to prepare it. Is that fair, Amy?
It's fair. However, they can make a motion and act this evening if they would like.
Yes, very much you can. I just don't think we were expecting that tonight.
Yeah, if you have a simple, something that can be done in a clear motion, that can be voted on and passed this evening.
Okay, so the question I have is, all right, I would like us to go forward with opening, following the CDC guidelines, the one-on-one businesses and the businesses that are not relying on a lot of people. And I would include like a health club, and then the one-on-one businesses that can operate following the CDC guidelines as they are written. And if they change, then the ordinance would change with them. I would like to see us do that. And if that means tonight we don't pass it and we have a special meeting with those words written in it, I'd be in favor of that.
I would, Mayor Johnson, if this would be a good time, love to hear the chatter that's going on in the public. Can we do that without a motion?
I agree.
Mike, turn your mic on, Mayor.
Sorry, does anyone have any more input before we move on to public discussion? Dave did make a motion. There's no second of it at this point.
Well, I guess I don't know if I made a motion. I was just trying to give some direction towards
Okay.
what I'm afraid we're going to do tonight. I don't want us not to do anything because that means it ends. And I also don't want to pass it as it sits. So
Yeah.
I guess I'm not really clear on what our options are there.
Your options are to make any amendments that you'd like. You can also do nothing, and that's what you were talking about, Commissioner Sarda. If you don't take any action, it will expire. You can direct staff to come back to you with some revised language, which, through your discussion, that may be an opportunity for us to get an understanding of where you're going. And we could come back with some revised language to you probably as early as tomorrow night, and then consider that at a special meeting by a resolution on Thursday, for example. If you're giving direction about specific businesses, we could certainly put together some different language that way as well. Or you can make specific amendments this evening too. That's just a little more difficult in that if you're, making motions and then debating them and all the amendments that can come along with those motions.
Okay, gotcha. So yeah, my intent is not to let it end. My intent would be to modify or amend it. And if that requires a special meeting, I'd be in favor of going that direction.
I would also like to do that.
So is that a motion and a second, or is that just?
So if I need to put that in a motion, that is my motion. Al, you got that?
So the motion, to clarify, the motion would be to schedule a special meeting to discuss amendments to the ordinance.
And that would eliminate the one-on-one service businesses is what you want to allow them to open up after May 1st. Is that what I'm hearing?
Okay, let me go back to my question. So do I need to make a motion to give staff that direction? I would rather not. If we don't need to, then I would just soon get a consensus from the commission that we direct staff, if that possible.
Yes, you can direct staff without a motion. And you can, two of you can set a special meeting, or the mayor can set a special meeting. What I'm hearing is that's probably going to happen. So I know Colleen is listening. So if you let us know, we can get going on that for having a special meeting, and we can go back and craft some language for you to look at. You don't need to make a motion to tell us to go back and make some amendments.
My understanding is that we're trying to get this done before May 1st. Is that correct? The meeting and the amendments.
Well, because otherwise you have if we don't, it will expire. If we don't get something for before you to vote on before May 1st, then it could expire, and then then we're starting, we're starting almost from square one.
So again, I would encourage us to pass the motion as is, accept the health board's recommendation, and get this work done behind the scenes instead of racing to get it done by Friday. And I'll be happy to make a motion, but I don't want to step on Dave's motion if he's made a motion, and I can't tell if he has.
So I have not made a motion.
I would move that we accept the health board's recommendation and remove dog grooming and tanning salons. And in the meantime, develop strategies and help businesses figure out resource management as we plan to move toward lifting of the ordinance in 2 weeks.
I'd second that motion. Weber.
Okay, we have a motion and a second. Is there any more commission discussion on that?
This is Mason. Before voting on this, could we talk about amending Amy's motion to add some other businesses to that list of dog groomers and tanning salons?
Since the motion is pending, you need to motion to amend.
Thanks for the Robert's rules, Roth.
Robert's rules question. Now that we have a motion on the table, can we hear the public commentary?
Okay, let's go to the public input and then we'll come back to this motion. Dave, what have you heard on the phone lines?
I drew the best job tonight as far as comments are concerned. The phone has not rung once, and I have even double checked to make sure it's fully functional.
All right. Brad, what are we hearing on the YouTube channel?
I have about 7 pages of comments I've been copying and pasting, so I'll work my way through those.
Brad, we're getting a lot of feedback from you.
I just have my mic on. I don't know if anybody else happens to have their phone or mic on, that maybe we're getting some feedback, but that sounds a little better.
You sound much better now.
Okay, I have about 7 pages, and then I'll go back and check what might have shown up since I've read these. I've tried to take every individual who's commented and put their comments together. Hopefully that makes some sense. I'll try to read slowly enough that if someone wants to stop me and answer a question, I'll try to be aware of that. Kimmy Steebrel says, does the 7-person rule include workers, or is it staff and customers too? To uphold our license, we have to follow the CDC laws and sanitation. Yankton is losing business and others are traveling and coming back, or the future perspective, we just need to prepare and live with the virus. Cullen Wilson says, does the 10-person rule apply to churches? Tiffany Kite says, I would like to know if groomers are going to be allowed to open. I have a pet grooming business who was offering curbside pickup and drop off and not allowing anyone in my business, yet still had to shut down. Why are vets and doggy daycare allowed to be open for grooming, but not a sole grooming business? Fran Livingston says, I agree with the health board recommending that dog groomers can open. They don't have people coming and going in a steady stream and only have dogs on premises other than the groomers themselves. Someone commenting as Covo 12 Virginia says, yes, we would like to reopen with caution, with our common sense. I like what Hoffner said. Our small business still has not received any extra financial help at this time. I'm afraid our economy will suffer greatly. I feel we need to follow Kristi Noem's guidance. Sioux Falls is a tier 1 city. We are also a tier 1 city. They have shut down salons, haven't shut down salons in Sioux Falls. So I'd like to know how many cases have been associated with salons. We need to use common sense, our sanitary guidelines. We are able to order supplies from Amazon. If we have 2 to 3 cases per week till August, when do we, as small businesses, open? We are cautiously planning a guideline. We as salon owners already know state boards and regulations. We need to have a soft opening. We are planning to be proactive and able to use common sense. I strongly disagree with Ms. Minor. We are going to be extremely strict with our plans and resources. We care about our own health and clients' health. We are going to be extremely cautious, need to open our businesses. We are prepared to give us, Mrs. Weber, please give us, we are prepared, give us a chance. We follow the rules. We've had time 1 month. Our clients are going to Sioux Falls to salons. We will be more at risk if we keep waiting. One-on-one with soft opening. Smaller businesses can control our atmosphere. Salons especially know South Dakota guidelines already. We can both wear masks. How about chiropractors? Isn't that close contact? Are they both doctors and patients wearing masks? Have you seen essential businesses right now? It's more of a risk going to Walmart. What is your financial plan for us businesses? I disagree, Mr. Mayor. Packing plans are the problem. We as smaller businesses have had time. So what happens this fall? Are you going to keep us closed? No, we have more problems if we wait. Strongly disagree. Let us use common sense. We are able to handle this. Totally agree with Mr. Hoffner. Style and someone commenting as Style and File Salon says, haven't gotten any help from the state or federal government. We stylists could give other businesses tips to sanitize, follow governor's lead. Why not try to have a soft opening, then reassess? We know our clients and trust them completely. We want to stay healthy. We need to learn how to live with the virus. Keep educating us along the way. Our clients will be understanding but happy that we can get to them sooner than later. Please leave it to us individually like the governor has said. Cassie Fortin says, we have not gotten any income in over 4 weeks. Unemployment income is taking their sweet time to get us funds. We need income to provide for our families. Most salons have state guidelines through the boards that we have to follow, along with Nebraska salons opening their salons back on May 4th. Should it be our responsibility to provide masks for each client, or do they supply their own? So what are you as a community going to do to help support your small town businesses? Unemployment and loans are not covering expenses and income to help raise our families. I live in Mitchell on the interstate. Our salons are open. Lexi Mitchell says, we have courses that we can take as stylists to get certified in sanitation. Bonnie Gusso of 302 East 16th Street says, please follow the recommendations of the health board. Could the city secure PPE for the medical facilities before opening? Your decisions tonight could impact their capabilities. Ashley Hufford says, I agree. If salons are to open, we will be using up a lot of PPE that the medical field will need. We would have to have PPE to operate safely. There is no way for salons to open and operate while keeping the 6-foot distancing guideline. We are within inches of people's face and touching them on a constant basis. I definitely think that hairstylists are at a high risk of contracting the virus, and more importantly, a high risk of spreading it to the many people in and out of the business all day. The virus is in the air. There is no way for us to be protected from that, no matter how much we clean and sanitize. As soon as salons are open, many people will be coming in, causing a lot of germs to spread. Michelle Pinkelman said, I agree with Commissioner Minor. Kayla Kolda said, I have no PPE for clients to use. You can't stand 6 feet away doing a haircut, manicure, lashes, etc. As Dr. Piedla said this morning, they need all the PPE they can get. Garrick Tracy says, when do personal business responsibilities come into play? You want a haircut, bring a mask, or no services rendered. Someone commenting as Rayberg 2020 says, we have 27 cases in the county. How many are actually in the city? Open up this town. If you are scared, then stay home. You say you are listening to scientists. The recovery rate is 98.5%. So few cases here. We are not Atlanta, New York, or even Sioux Falls. Open this town up. There were over 40 cars at Baumgars today. If that is safe, ? A small business can control their operations. Completely agree with Mrs. Mosier. So much fear, be responsible. We are better than this. Follow the governor. What about outside bars? They should have more than a 10-person, 10 inside, 10 outside. Chuck M says, open up everything so we can get on with our lives. Kevin and Courtney Upsall say, we are not opposed to staying closed until the 15th. We won't open until then if permitted. A couple of concerns. The 11th doesn't give us time to the 15th to order, time to staff between the 11th and the 15th, then be told to stay closed. So now we have an abundance of food, etc. We have guidelines now for staff and everyone is working just curbside and delivery. We think there should be a plan in place that's more specific. We don't want to open and close again. We can certainly manage and open to the 10-foot rule. You have to make a decision. No small business owner can prepare or over prepare. That's more of a financial burden. Please make a decision. Katie Rhetoric says, I am 100% with Minor. Stylists are closer than most doctors and nurses for 1 to 3 hours at a time with one client. I am not 6 foot, I am 6 inches. No stylists know how to clean and sanitize, but that client doesn't. We need correct PPE just as medical facilities need. Molly Wellenstein says, thank you, Minor. Michelle Pinkelman says, I agree with Commissioner Minor. Kayla Kolda says, 100% Minor, all said also. Jaden Schaefer says, thank you, Weber. Ashley Hufford says, completely agree with Minor as well. Carla Anderson says, hey, way to let 9 people, most of whom do not run businesses, decide which businesses get to open. Also notice the only businesses they close are the small ones. If you're worried that close the factories and big box stores, so they are going to pick and choose even more winners and losers. We have had 27 cases with 1 hospitalization. If that is overwhelming a Vera, they are pretty incompetent and you have no empathy. They should only be allowed to vote if you're not getting a check right now. And the more you do behind the scenes, you do more behind the scenes, that isn't suspicious at all. Lexi Mitchell says all the factories are open though. It's small businesses you shut down, but salons are getting no income and clients are going elsewhere. Almost 5 weeks closed and no unemployment. We know how to clean and be careful. Megan Becker says we are not supposed to be traveling like that. Salons will not be able to do a soft opening. We will have a line around the block when we begin to open. It doesn't matter how we clean or sanitize, it's in the air. Wendy Book says, I like exactly what Minor and Fertig said, pro-business, but have a solid plan. If everyone does as they want, it seems to take 2 steps forward and 10 steps back. Valerie Graves said, there is no proof that masks help and nurses wear masks all day. There is no proof that masks help and nurses wear masks all day. Lakin Schmidt says, should salons take PPE from the medical field? Brianna Brandt says, it's not PPE, it's not just PPE, it's proper PPE. Tuxedo is making materials for hospitals out of Tyvek wrap, so why should more businesses take away from that? Manufacturers cannot keep up. Kristen Albrecht says, it's just like when you stop taking antibiotics and you start to feel better and you start feeling sick because you didn't take the antibiotics. Craig K says that maybe it is time for a recall of city officials. Seems like major power trips going on, people making decisions with no more than a lunchbox invested in their jobs. Jesselyn Lynn says, I am not fearful for myself. My concern is others. And with these soft openings, how beneficial is that going to really be? Why not open up salons, then have the potential to close again? If salons open, people will be camping outside the salons like it's Black Friday guaranteed. Shelly Sangster said, groomers are one-on-one with dogs. Lisa Reichen says, let health clubs open up. Let health clubs open such as Anytime Fitness that has limited staff to clean, ? I agree with Kevin Upsall as much as it sucks for small businesses. Working in healthcare scares me to even frequent for takeout if we open now, and Lord knows I need my hair done. Every business could claim one-on-one service. A waiter waits on me, and that's a one-on-one business. Kristen Albrecht, our #1 priority needs to be keeping people in Yankton safe. Dina Heaney says, we need some sort of resolution tonight. We are struggling emotionally and financially as stylists and nail techs. I'm going back to the comments, so these are not in the order of commenters again. Kovo 12 Virginia says, yes, we need a resolution tonight. Casey Fortin says, opening some small businesses but not others is discrimination. Katie Redrick says, sorry, I've lost my track again. Yes, Mrs. Minor. Megan Becker says, thank you, Weber. Raybeg 2020 says, I can't actually read it. It says something about the governor's rules. Style and File Salon says, please don't leave us hanging. Dina Heaney says, let's get some thoughts, even if it's for a week. Covo 12 Virginia says, wrong, we have no resource management. We have no resource management, Mrs. Minor and Weber. Hair salons need to be open. Wendy Book says, Ashley, you will have to keep the gate closed and locked. Dina Heaney says, please do something. We are relying on you as our local government. We are confident in your decisions. Kayla Kolda says, hair salons cannot stand 6 feet away from one another doing a haircut. You touch people. Boat Fan says, Mayor Johnson is destroying our town. Ashley Hufford says, agree, Wendy. Natapi, someone commenting as Natapi says, I think it is a challenge because we can perhaps arrange for supplies, compliance from the business owners, but I have seen few people are willing to adjust their day-to-day. People seem to be purposely flouting, following any safety recommendations, no masks, etc. Silent File Salon says, let each stylist salon choose if they want to be open or not, no more ordinance. Karen Fendrick says, allow salons to open, restaurants with 10 feet seating, those still nervous don't have to open. Tanya Junkie says, people can go shopping everywhere else, but the small business seems absurd. The Natapi commented again, I would like to see some expectations for community members patronizing businesses to be expected and or enforced wearing masks, spatial distancing, etc. Boat Fan said, Weber made no sense regarding her comments on the EMS first responders. And to make a coherent comment, 64 Ranger says, hair salons are one of the cleanest businesses out there. We already get inspected every year. No one is making you. Katie Redrick said, we need at least 2-week extension to put our businesses in place. Salons need correct PPE. We are not restaurants. We cannot be 6 feet apart. We cannot follow CDC guidelines. Ashley Hufford says, you are talking about a lot of unnecessary spread in the potential virus if the salons are open. Katie Redrick says, you are asking us to put our families, clients, and their families at risk. People will lie to get their hair done. Jesslyn List agreed with that. Katie Becker says, there is no way we as stylists can say 6 feet apart. We are 6 inches away from their face at times. Molly Weinstein says, at salons, we cannot do a soft opening. People will be lined up, ready, waiting to get their services done. We do not have access to the necessary PPE for stylists. Nada P says, I do question the statements regarding consistent access to appropriate PPE. I do not think that Amazon supplier timeline resources will support this in reality. Someone commenting as 64 Ranger says, we have sat without pay and have had 5 weeks to prepare. We are ready. Rick Doherty says, I would like to have the use of video lottery machines addressed. It's a very easy to place machines far apart enough not only to meet but exceed CDC distancing guidelines. Kayla Kolda says, a salon cannot do our job standing 6 feet from them. We have to touch people to do our jobs. We stand within inches of people and have no PPE, nor will we get some this quickly. Melissa Maska says, recommend following the directions of the health board. 64 Ranger commented, if you don't feel safe opening your if you don't feel safe, don't open your salon. And then Bofan says, open this town. Craig K says, I would have more faith in our leaders if they were business owners also. They have no idea what they're doing, just being followers and not cutting it. Lexi Mitchell says, if you are scared to open your salon, then don't. Some of us need to work for money. Cami Guthmiller says, the consensus is keep businesses open and use CDC guidelines. Don't open if you aren't comfortable. Natapi says, I think we need to consider the disconnect between in-city measures and lake businesses. Casey Fortin says, are these people that didn't want to open their salons getting money and resources we don't know about? Katie Rederick says, I am not scared to get myself sick, even though I'm pregnant. I'm worried about our clients' health. Bothan again says to open up Yankton. Valerie Graves says, if the business is concerned about opening, they don't have to. It is not within the government's right to decide which businesses are, I believe they meant to say open, and which aren't. Leave it up to the individuals. Ranger 64 repeated himself or herself. Tiffany Kite said, pets are more at risk of dying because of overheating due to not being groomed. Katie Rederick says, we need to be more demanding on the governor, help than opening and risk a spread before we are positive about how to handle this correctly. Bothan again commented, influenza has 31 deaths just this season in South Dakota alone. This virus only has 11 deaths in South Dakota. Dina Heaney says we need to listen to our medical board. Katie Rederick says we do other services in salons that are closer than a typical haircut. Covo 12 Virginia again says open this town. We are smart enough to handle this. And Kayla Colda says lash extensions are inches away from faces. And those are all the comments at this time.
A lot to digest there. Amy or Colleen would be.
Interrupt once.
A lot
I
to digest there. Amy or Colleen would be. A lot to digest there. Amy or Colleen would be. A lot to digest there.
So I have just a couple comments that were emailed in. Scott Hansen says, in our country, we value personal freedom to make our own decisions. I believe we should allow all the currently closed businesses to be open with social distancing precautions required where possible. It should be the decision of the business owner and their customers if they are willing to take the risk. People would still be free to stay home and isolate. Kurt Hauser says, if you do away with the ordinance, how can hairstylists cut hair safely without N95 masks and gloves? If they are infected with no symptoms, they will expose 10 people a day for at least 2 weeks. And I received a Facebook message that is from Salon Centric that says, following the recommended safe salon guidelines published by the Professional Beauty Association and in alignment with local ordinances, we have mobilized a team dedicated to sourcing everything a stylist or salon owner would need to get back to work safely. Beginning in early May, we will see weekly deliveries of non-surgical masks and hand sanitizers that we'll be providing at cost to beauty pros as states reopen. We'll be layering these absolute essentials with a variety of other products, including disposable gloves, cleaning products, disposable capes, and chair covers, and many other items that will provide a safe environment for beauty pros and their clients. We are committed to providing salons and stylists with the products they need the most to get back to work as safely as possible.
I also have a couple of comments, one over text. 2 concerns opening is we are 1 hour to south, 1 hour to west, 1 hour to the north of 3 of the top 10 fastest growing hotspots, if I understand what that means correctly. And the hospital isn't doing elective surgeries right now under sterile conditions, but yet we are considering opening up slowly. This is the reason I avoid public office, but I respect everyone who, including you, meaning me. I also got a text, but that's the same salon-centric item that Colleen just read. So I think that's it from my end. Mary, I think you have a caller as well. I just want to let folks know we had one person who wanted to address the commission initially, so I gave the link to the individual you're going to hear from. And then I soon realized we have way too many to include. So that's why, this person is on the call, but going forward, we'll just use those other mediums that we've been going through.
Zach, are you there?
Yes, I am. And thank you so much for having me, Mayor. Go ahead.
Make sure you introduce yourself to everyone. Thank you.
Okay, yes. Mayor, members of the council, my name is Zach Negebauer. I'm the CEO of Year-Round Brown. I've been on this call since 6, and I thought there's been a lot very insightful comments, so I'll try to keep it very brief. I know you've all been here for a while, but Year-Round Brown is a family-owned business. I'm second generation. My dad started 41 years ago in Sioux Falls, South Dakota. We have 6 locations in Sioux Falls, Brookings, Watertown, Vermilion, and we opened our 10th location in Yankton in February of 2021. And we are very proud to be in this great community. And I think it's obviously I've heard so much about the pro-business community and how great people are in the community to want to see it grow and be prosperous. And we've seen that firsthand working with people in the community. And so, my issue is I wanted to speak about, tanning salons in general. And I've sent emails to the council, and it sounds like that's on your vote tonight. Before I ever even heard of the term social distancing, I think we were probably practicing that in our industry because of the private nature of the business. We do sunbed tanning and spray tanning that are all done by a machine, not an individual. You walk into your private room and you leave. But to kind of go off what I've heard other council members say, I would encourage you to put trust in your small business owners. There's so many remarkable businesses in Yankton, and I can tell you firsthand, as a small company, we adapted very quickly. In mid-March, when the CDC guidelines came out, we put our scan guns. So when the customer used to hand their key card to our employee to check them in, we now let the customer check themselves in, keeping that safe 6-foot social distance, and they walk right in the private room and they leave. We even created an app in less than 24 hours. So if you were to walk in and you were to be, over the CDC guidelines of 10 patrons or less, we would ask you to go in your car and wait, and the app will actually text you when your private room is ready. And so, we put a lot of those measures in place. I can tell you we've been open in Sioux Falls, Watertown, Vermilion. In this entire time, at Year-Round Brown, we haven't had one incident, and, knock on wood, and we've taken measures very, extreme or very carefully, but I think we've, done a good job, and we'll continue to do a good job and looking for that, future guidance. But I would just ask that you consider that, and just consider all these non-essential businesses. They're trying to do the right thing, and I know it's a very delicate balance of, healthcare, but also economics. But I know a lot of businesses are going to go above and beyond to do the right thing. I think that's a great thing about capitalism. It's somewhat self-cleaning. If in the fact that you don't do the right thing, you don't treat your employees right, your customers right, that gets out, especially in a small community, and you won't have people working for you or want to work for you, and you won't have customers coming to you. So I would just really urge everybody to, when the time is right, when you feel it's right, to put that trust in your small business and give them an opportunity to do things the right way and to be prosperous in your community, but also keep people safe. Lastly, I just, one thing that I think is so important is planning. You plan in city government quite extensively, obviously, and you plan a lot in business. And so, what we knew 30 or 40 days ago was a lot different than what we know today. And thankfully, a lot of the information is better than what we thought, which is good, but we still have a lot to work on and improve on. But, all these businesses have to make a lot of plans, renewing leases, opening stores, making investments. There's individuals in the community that, maybe you're thinking about building a house or buying a lot or making a big home addition. And I would love to see some guidance in the future when you can put out to say, hey, if there was a big break, because I know the chief of the CDC said, we're looking for, nationally, it's going to be, coronavirus could be in the United States for 10 years. 80% of the population could get it in the next 18 to 24 months. So it's going to be here. And if there is an outbreak in October or next February, what are you going to be looking to? Is it a hospitalization rate percentage? Is it an infection rate percentage? When would you potentially re-shut everything down, or would you not? I think just providing that general guidance to all the citizens would be really helpful in making business and personal decisions, not right now, but in the future, like this fall or next spring. So with that, that's all my comments. If you have any questions, feel free to reach out or ask me now.
Thank you, Zach. Any questions? Zach, really appreciate you hanging around for almost 3 hours to provide your input to us, and thank you for those thoughtful comments.
Thank you for having me. Appreciate it.
Yeah. All right, so we had a motion and a second on the table. Al, could you reiterate for us what that motion is?
Okay, the motion was to follow the health board recommendation to extend the current ordinance till May 15th and excluding the businesses of dog grooming and tanning salons. So they would be eliminated. They would be allowed to open May 2nd. And this was moved by Minor and seconded by Weber.
Is there any more discussion of that motion?
Yeah, this is Commissioner Schramm. So I've talked to probably close to 100 different people, individuals, businesses in the last couple of days, and it's literally been about 50-50 where what we should do: open, extend, or just let the ordinance expire. And I'm really on the fence on this, and I think I've come to the conclusion that I don't think we can pick and choose which businesses to open that have been closed. I don't think that is fair to anyone, any of the business owners that are out there. And I think that, other communities around us are open. It's really hard for us to be the only community in the area that's closed. That's hard for our business owners to see. But I really appreciate what Commissioner Minor said, in that we need a plan, and we need and what comments I've been reading and seeing online is that we need a plan for how do we open. And I would say that I would make a motion to amend the motion on the table to open up all businesses on the 15th with a soft opening with social distancing in place, and not picking and choosing at that point. And I am open for questions and discussion on that, but I think it's going to be really hard to pick and choose. I think we need to put the onus back on the business owners in Yankton that have shown us really good faith and trusting us in this first month as commissioners, to put it back on them to say, we have faith in you that you're going to do the right thing.
I would chime in, and I don't know where we are with the double motion situation, but I like that idea, Commissioner Schramm, that we're moving towards a soft opening. I absolutely trust that people have plans in place and have been thinking about what this looks like, because we know COVID is going to be with us for a period of time as we move forward. My concern is the resources. I was happy to hear from one of the email comments that somebody is going to be helping to source salon owners starting in May. More of that needs to happen. I just think it's that measure twice, cut once. I would love to see us work together to move forward, and then when we open, have a strategy and plan and cooperation and buy-in.
So is that a second, Amy? Is that a second of?
Can I second it when I made the motion, the first motion? I feel like I'm violating a rule.
Then Mosier will second the amendment.
All right, so we have a motion and a second. Yeah, Amy, do you have a question?
I need the motion reiterated, please.
Yep, so the motion, and correct me if I'm wrong, is that on May 15th, all businesses would be allowed to reopen.
I believe Mason said social distancing and such.
Correct.
With
I did, social distancing in place.
Basically, aren't you
So,
then just saying, Mason, that they would have to follow CDC guidelines?
Yeah, I think that might be the simplest way of stating it because those are well-established guidelines put up by the CDC.
But are we in discussion now with a motion and a second motion and an amended motion?
Yes, and it looks like the city manager has some questions for us.
I do, just to make sure I'm clear here on where we're headed. And we are, with that amended motion, we're putting what I'm hearing is we're putting the trust in the businesses to have their own plan with their unique business type to reopen according to the CDC guidelines specific for their type of business. Is that what I'm understanding?
Yes, that would be putting it back on the businesses to be responsible. I don't think we can enforce it anyway, so we're going to have to effectively. So we're going to have to put it back on them.
Okay, thank you. I reserve the right to ask you guys more questions, but I've got it so far.
I think the point of clarification here, and I know we will not even become close to pleasing everybody, no matter what we decide. But would anybody argue, and I wrote down, I appreciate everybody's thoughts and feedback. I really do. Not only Zach, but I think a lot of people have been with us for 3 hours listening to this. If we choose to follow this, my big thing is, and I wrote it down, no one has to reopen if they're not comfortable or can't follow CDC guidelines, correct? That also means as individuals, no one has to go to businesses that reopen if they're not comfortable. I mean, if we would say a soft opening on May 15th and following CDC guidelines, that's still the business making the decision to open, and we as adults making the decision to go. Am I not correct in that?
Commissioner Moser, I agree with you on those comments, and I was not exactly what I was looking for and what we were going to do tonight. I prefer just have the one-on-one businesses, but I think Mason, you made a good amendment to the motion, however you want to put it, and I think that's a good idea. It's a good start for our community, and we can react quickly if something does come up at a later date. If it's in July, August, we can react quick to put something else in place if needed.
Okay, so I just want to make sure I understand this fully. So number one, it's an amendment to the motion. So the original motion that was made would go into place. Does that mean that dog groomers and tanning salons can still open up on the 2nd, but then as of the 15th, that's when it's a soft opening for everyone else?
Yeah, I was going to ask that point of clarification myself. I don't think we want to keep holding on to dog groomers and tanning beds till the 15th.
Correct. The way I was believing I was saying it is that we would take Commissioner Meyer's motion as was, and I'd add the language that I added.
And my interpretation was that we were accepting the health board recommendation, which allows dog groomers and tanning salons to open, and then looking to open all businesses, soft opening. They'll have strategies. We'll know more about guidelines. The governor will give us some information tomorrow, and hopefully businesses will have the resources that they need to open safely.
And does the commission want the health board to weigh in on any subjects leading up to that, or is the health board's work here done?
I would think that we have to watch the numbers. If our numbers stay steady, I don't know that there's a lot more to discuss. If the numbers change, it's a different story.
Ross, just, excuse me, Mayor, may I ask a city attorney a question? Ross, are those edits that you can make here that could be voted on this evening, or would you want to have more time to go back and work on those? They seem pretty straightforward to me, but I don't want to put you on the spot.
Yeah, okay, so I think the short answer is yes, but I do have a point of clarification that I'd like to take the commission through. So if you can think of the ordinance as having two parts, one is the closure of businesses and the other is the 10-person rule. The motion that I see before us addresses the business closure side of it, where we're deciding by voted resolution of this commission which businesses are subject to this ordinance and under what conditions or circumstances we are going to allow them to reopen. If that's the case, that's a resolution. That's pretty straightforward. I'm wondering what this means for the second half of this ordinance, the 10-person rule, as we have currently passed that, because that particular chunk of the ordinance is going to have an impact on all of these businesses when they reopen if we also don't decide what that is going to mean. And maybe we don't need to decide that until the 11th. I think you guys have some time. You don't have to extend the 10-person rule either if you don't want, but I think we need to all be of one mind as to what happens to that half of the ordinance.
Do we just defer to what the governor's guidance is on that?
That would be a policy question for the commission, although I would recommend that if we're continuing the ordinance until the 15th, that we maybe just leave that portion of the ordinance in place until the soft open, just from a logistical consistency standpoint.
I would clarify this, Commissioner Mosier. I would be uncomfortable just saying we'd follow the governor's guidelines, having no idea what those are.
I'm comfortable with the 10-person rule through the 15th, and then discuss what's going on at our May 11th meeting and how we want to address that. Again, the governor's planning to give us some guidance tomorrow, maybe even next week. We may know more by May 11th about what we can or cannot do.
The one thing I would, this is Commissioner Fertig, one thing I would just, something to think about, if you're gonna say all businesses can open as long as they follow CDC guidelines, well, that's again going to put businesses like hair salon stuff out because they can't do the social distancing because they're right on top of each other. Just something to think about when it comes to that point.
Any more commission discussion? All right, so we will vote first on the amendment. And the amendment is to allow all businesses to open on May 15th. Is that it? Do I have it all? Is that the whole amendment?
One more point of clarification. Do we mean by all business, does that include gathering places like churches and halls that can be rented, that kind of thing, as long as you can keep according to the guidelines?
The way I understood Mason's motion amendment was all closed businesses would be presumed to reopen so long as they followed the CDC guidelines for what he deemed a soft opening. Is that correct, Mason?
Yes, that is my intention.
And that,
So walk through the scenarios. If we vote yes on this, then we go to the regular ordinance and we vote yes on that. This goes into effect the 15th. A no vote on both of these, what happens? Then the ordinance as written stays in place.
Correct.
Thank you.
I'll just add, from my perspective, I don't know that on May 15th, I'm going to feel comfortable getting rid of the 10 or more rule. We'll see what we know then, but that might be a hard one. So I don't know how we address that. If we do it later, I mean, that creates some uncertainty for people who need bigger crowds, even if they're planning to do social distancing. But that being said, there doesn't seem to be any more discussion. So Al, roll call, please.
Okay, and we're voting first on the amendment that was moved by Schramm, seconded by Mosier. We'll start with Benson.
Yes. Benson's yes. Aye.
Benson's an aye. Sarda.
Sarda, aye.
Sarda's aye. Fertig.
Fertig, aye.
Fertig is aye. Hoffner.
Hoffner, no.
Hoffner is no. Minor.
Minor, aye.
Minor is aye. Mosier.
Mosier, aye.
Mosier is aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber is aye.
Weber is aye. Mayor Johnson.
Johnson is aye.
Mayor Johnson is aye. The motion to amend passes 8-1.
All right, so we're back to the original motion, which is to follow the health board recommendation of extending the ordinance through May 15th and allowing tanning salons and dog groomers to reopen on May 2nd. Any discussion on that?
I would just like to ask, is this the time to have a brief discussion about hair salons, or are we throwing hair salons in with the May 15th businesses?
I believe the amended motion is all businesses, so they would be included on the 15th of May.
Now, could we include them in this one like we did with dog groomers and tanning salons?
With another motion.
My understanding was that would be included in the 15th unless there is yet another amendment to the motion.
I will amend the motion to add tanning salons to, along with dog groomers and tanning salons. Did I say that right? Hair salons.
No.
Hair salons, tanning, and dog groomers. That's the motion.
I would second that motion.
All right, we have a motion and a second. Any more commission discussion?
I would just
Dave,
like to reiterate again, Mayor Johnson, to the public, if they're still with us and haven't given up on us yet. My point that we are offering businesses a chance to reopen. It does not mean they have to if they are not comfortable and don't have the safety equipment they feel they need for their employees and customers to be safe. So I just want to reiterate that again.
And I would, sorry, jumping in, Minor. I think given the nature of the business of the salons, I think they particularly need not only a plan, which it sounds like many of them have, but they're going to have to start gathering resources. So personally, I would like to see that added to the May 15th opening.
Any more discussion?
You read back that motion to amend?
Al, can you read that back for us?
Well, if I understand it right, Sarda moved and Benson seconded that we add hair salons to the previous recommendation that includes dog grooming and tanning salons, that they would be allowed to open on May 2nd also.
All right, so we'll do this amendment vote. Then I'm going to go back and get any more public comment before we do the last vote, if that sounds okay to everyone. So with that, Al, please do roll call.
And this is roll call on the Second Amendment, not to the United States, of course. Sarda.
Sarda, aye.
Sarda, aye. Fertig.
Fertig, aye.
Fertig, aye. Hoffner.
Hoffner, no.
Hoffner, no. Minor.
Minor, no.
Minor, no. Mosier.
Mosier, aye.
Mosier, aye. Schramm.
Schramm, aye.
Schramm, aye. Weber.
Weber, no.
Weber, no. Benson.
Aye. Benson, aye.
Benson, aye. Mayor Johnson.
Johnson, no.
Johnson, no. Second Amendment passes 5-4.
Okay. Now we're at dog groomers, tanning salons, and hair salons opening May 2nd, and everything else opening up May 15th. Correct? Any more discussion from the commission on that motion? All right, let's see if there's any more public comment. Dave, are you hearing anything on the phone line?
There have been no phone calls.
Brad, what are you hearing on the YouTube channel?
There are quite a few comments again, and they occurred throughout the conversation, so some of them may apply to things you've talked about. CF says, my only concern about opening businesses is what happens when the next wave comes through. Word is that the virus won't dramatically hit Yankton until midsummer. Valerie Graves says May 2nd. I think that's meant to mean open everything on May 2nd. Megan Becker says, how do you socially distance from a client in your chair? Bonnie Gusso says, thank you, Commissioner Schramm, for very reasonable. Carla Anderson says, experts have been changing the peak every few days. I don't think they have a clue. Michelle Pinkelman says, what if a business can't follow CDC guidelines? Lisa Reichen says, a salon cannot do that. It's unfair. Kevin Upsall asks, so there will be no extension on the 15th, is that correct? Natapi asks, how will this be monitored, maintained, or enforced? Jamie Reichen says, what if there is a surge in numbers before the 15th? Kevin Upsall said, thank you, Mosier. Kovo 12 says, thanks, Mrs. Mosier. Ashley Hufford says, so would salons then remain closed after the 15th still? There's no way to follow the 6-foot social distancing guidelines in a salon setting. Natapi says, while this discussion is about business ordinance, will you be releasing any recommendations regarding the use of public spaces or gatherings? Lisa Reichen asks, Ashley says, sorry, that one is a response to someone else. Alyssa Miller says, we make the decision and can't operate due to CDC guidelines because it is our choice. I don't think we can get aid. As a massage therapist, we can't operate with CDC guidelines. I'm not sure though. Kovo 12 Virginia says, everyone should be on the same date. May 2nd, we have our resources ready. Kevin Upsall says, we know it is hard for the commission to make these decisions. Let us small business owners help with those decisions. Let us submit our plans of safety to help make the decision of letting all reopen. Kylie Lemke asks about parks. Natapi says, I would like to see businesses publishing their plans for public record or review. That would allow people to make more informed choices about how to patronize them. Lisa Reichen asks, what constitutes a soft opening? Kovo 12 Virginia says all essential workers need to follow healthy guidelines. They are not always being cautious. We as smaller businesses, salons especially, should not be excluded. Natapi says, I am also concerned to see how these decisions like this will create unexpected wrinkles, aid, etc. Brittany Trimble says, tough conversations, 10 people including staffing, question mark. Lisa Riken says, but a salon cannot open with CDC guidelines. This was not clarified by the commission, but I think the CDC guidelines for the various business types would clarify this. Jesselyn List says opening salons is going to put us all back at square one. Ashley Hufford asks, how can opening salons be safe? And then we don't open restaurants yet. Tiffany Kite says, is grouping hair salons in with grooming going to cause my grooming business not to open if this doesn't pass? Megan Becker says the chain of contact is too long for a stylist in a day. Tom Stotes asks, what about baseball? Kayla Kolda says, so we just completely ignored the health board guidelines, lost PUA for stylists as we cannot operate under social distancing and CDC guidelines. And then Dina DH asks, is nail salons included with hair salons? And those are the comments I see right now.
Amy, are there any of those comments you want to respond to?
Yes, I will in a second. Let's let Colleen see what she's got on email.
Please proceed, Colleen. Colleen, are you there?
Okay, I have one email. I understand the dilemma and possible consequences of a potential premature opening. The community, its businesses, its citizens, and the city commissioners have had 5 weeks to figure this out. And now we're scrambling. And now we're scrambling at the 11th hour to figure out what we're going to do. I appreciate the fact that we are dealing with something that is ever evolving, but May 2nd did not just come out and start this. I agree with Commissioner Mosier in the balance tripod. There has to be also a concern for the mental well-being and mental health that these closures could potentially cause. I also agree with Hoffner that by allowing some of these smaller businesses to open, it would alleviate the higher numbers at the larger businesses such as Hy-Vee, Walmart, Menards, etc. We have been open with our local retail store with measures in place, including social distancing. I propose allowing the reopening with social distancing. Those that choose not to venture out are free to practice.
Was that it, Colleen? Okay. Proceed, Amy.
I have some comments first here, and then I'm confused about what waiting 2 weeks will do for businesses. I assume most have a plan in place to open under the restrictions already. Allow a small business to open up as long as they follow CDC guidelines. We have all procedures in place and could open tomorrow, as we have this currently in place in other communities. Text comment, who will enforce the rules of the guidelines? This is another can of worms. What are the ramifications if not followed? What about nail salons? Something incoherent on text that I don't understand. So I'll try to answer some of the questions that we have gotten. I'll do my best here. Nail salons will be incorporated in that tanning salons, nail salons list. So my understanding is if your motion passes, they would be on the 15th. Now we'll run into these questions from stylists that have like dual services. There's some locations where you have a nail salon and a hair salon coexisting. So we'll work through that with them. And we can do that. What about baseball? I'm not sure what that question is. And what about parks? Our parks are open. Our fields are open right now. we've prescribed at the city to our city facilities to be in line with the social distancing and the, the small groups only at this time. First blush, haven't not thought about it a lot since this is evolving, is that we would evaluate that over the next couple of weeks and see how our numbers are proceeding. And we, I'd visit with Parks and Rec and talk about that. But we've been recommending to people, don't plan on, getting together in your leagues and big groups, at least at the early part of summer, because there is maintenance that goes into opening fields and spaces, etc. Who would enforce these rules? Just like the ordinance is set now, the city staff would enforce them the best we could in cooperation with code enforcement and the police department. Be difficult, just as it is now, but we would trust that, just as has been, our businesses would do a good job communicating with us and working with us on their business practices. So lots of questions about, we can't follow CDC guidelines because of the type of work we do. I think we would have to understand that if you're opening hair salons, there's portions of the CDC guidelines that they can't adhere to. They can't adhere to being 6 feet away and doing your hair, but you could adhere to having, small numbers of people in your shop. You could adhere to a wash in, wash out policy where you're, washing your hands, etc. So we'd have to work again with each individual business based on what it is, that form and function I talked about earlier, what it is they're doing to help them. The question about waiting 2 weeks, what will waiting 2 weeks do for businesses? I think that's a matter of us continuing to watch the numbers and see what happens there, but also then for folks that don't have a plan in place or need to do some ordering or need to do some staffing, having some more time for that. Or folks that are not chains may not have a structure in place from other companies. So allow them to put their plan in place or work with us on a plan. Will City Hall open on the 15th? Not necessarily. This is the public's business, but I'm in charge of the day-to-day operations. So I want to take a look at things and look at our operations, talk with our staff, and develop our own plan of what I would think would be best for the facilities here. So that's the question that I received there. Were there other specific questions? I didn't get them all jotted down. So if there's another one that stuck out to you, we can talk through that. Your memories might be better than mine, but that's kind of what I gleaned from the questions asked on the chat.
Well, I think if tonight's proven anything, it's that there are no easy answers to this, and there's a lot we know today that we didn't know 5 weeks ago, and there'll be a lot more we know a few weeks from now that we don't know today. And so we will continue to try to make the best decisions we can based on the information we have. And I think it's a real testament to the commission that we had very different opinions coming into tonight, and I feel really in a pressure cooker based on the different and very intense input we were getting from the community. And we had a very thoughtful and respectful conversation to get where we are now. And with that, is there any more discussion before I throw it to Al for roll call?
Mayor Johnson, one thing that I think needs to be clarified that I heard that, I'm sorry, Amy, if you answered, I think somebody said, would we extend past May 15th? If they make all these plans to open, would we do anything to change that deadline or add to it or take away from it? I know my thought on it, but I just want to make sure we're clear for the public what that means or where we might sit then.
I think that would be up to the commission. I think there's a lot of unknowns. I appreciate the comment that, I think this was a separate comment somebody made about, why are we doing this last minute? Well, things are changing by the hour and by the day, and that's uncomfortable. We don't like doing business that way either, but it's just the nature of this. So to me, that would be up to the city commission. If you feel there's reason to do something different as we get closer, then I think you would have to act. I think if not, you would continue on this path, and you might continue on this path until fall, and then in the winter decide you need to do something else. So that's my understanding of it. And there's discomfort with the unknown. So I think my understanding of this group on this commission is that you would do your best not to pull any punches or throw anything, surprise anybody. But given what we don't know today, which is a lot, things could be a lot different, a month from now or then going forward into the future. So we just have to keep listening to people and communicating. That's what I understood.
And I think Nathan asked, sorry, this is minor, about should the health board continue to meet? And I think when I made the original motion, in my head, I'm thinking if our numbers are staying steady, moving very little, then May 15th it is. And of course, that's what we're all hoping for and aiming for and striving for. And then if the numbers change significantly, then that's a different discussion for a different day.
Yeah, this is Commissioner Mosier. I guess a couple thoughts I have there. I mean, we're doing what the public's asking us to do, or the majority of the public's asking us to do, and that's give them a chance to prove that they can be responsible with their business, responsible to their customers. I would be the first to say, and I know I voted yes on all of this, that something drastic changes, it's kind of an all bets off, or we might have to adjust if we find that we go one way. I mean, that's part of what Amy's saying, is this can change daily. And if that change is that it gets drastically worse, the public, I think, would have to understand. I mean, our job still as city commissioners is to keep our public safe. And that might mean that at some point we're doing the bunny hop. We don't want to do that. So I would ask Yankton residents and business owners to do what they best can to keep us on the very low trajectory we're on. And, but understand that should something drastically change, that would probably force us to have to do the same.
Yeah, I think that's a good point. At the end of the day, the coronavirus doesn't care if you're for openings, against openings, or somewhere in the middle. It does not discriminate. It will come to any of us if we let it. So we all have our personal responsibilities to uphold here, and hopefully we don't have to go back. I think that would definitely be our option of last resort, to have to extend this again. We don't want to do that. We don't want to tell you that, yep, we're going to let you open and then go backwards. So we really hope that isn't the case, but that to some extent depends on all of you. So if you can out there, Jake, you got
Commissioner Hoffner. So all this amendments, I just want to clear up that I still stand against this. Voting no, I want to clarify this, that a vote no is just saying I respect all the health. That's letting the individual businesses decide whether or not they want to open and how they want to open for their health reasons. Many of them won't, and some will, cautiously. I respect, again, all the health going into this, but I still stand against. By voting no on this motion, I'm basically saying let the businesses decide May 2nd what they want to do.
Thank you, Commissioner Hoffner. Anyone else? Al, let's do roll call, please.
Okay, now we're voting on the original motion as amended by the two amendments that both passed. We'll start with Fertig.
Excuse me, Ross, do you have something?
I just, for the sake of the record and to make sure that the public is clear, the enforcement of the ordinance is clear, this is effectively continuing the ordinance in all respects that we have right now, except paragraph 2, relieving dog groomers, tanning salons, hair salons, in all other respects, it's staying in force until May 15th with an anticipated soft opening of all businesses thereafter. Is that what you have, Al? I want to make sure that the
Correct.
entirety of the ordinance remains intact aside from that.
Correct.
Okay, very good. Thank you. Sorry to interrupt.
We were
Okay,
at
now,
Burdick voted aye, I believe I heard.
okay, Hoffner.
Hoffner, no.
Hoffner, no. Minor.
Minor, aye.
Minor, aye. Mosier.
Aye. Mosier, aye.
Mosier, aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber's aye.
Weber's aye. Benson.
Benson's aye.
Benson is aye. Sarda.
Sarda, aye.
Sarda's aye. Mayor Johnson.
Johnson is aye.
Mayor Johnson is aye. Motion passes as amended, 8-1.
All right. Does anyone want to stick around and chat for a little longer?
Motion
I
to
just
adjourn.
No, 3.5 hours is enough. Yes,
I did hear
City Manager
Sarah.
Leon.
I did hear Sarah make a motion to adjourn. So just real quick, I'm asking the public to give us time to recalibrate here. We'll need to get the new language drafted and put out. We'll get it to you. We'll get it out there. We're gonna need a little bit of time. Folks can call anytime and we'll get to your, get to the clarification and we'll call you as soon as we can. We're gonna use the, 5251 or email and we'll answer questions about this, but we might not get you responded to right away tomorrow because I'm guessing there's going to be a lot. Thank you.
All right, so Sarda, you made a motion to adjourn?
Correct.
Benson,
All right,
second.
do we have a motion and a second. Any commission discussion? Al, roll call, please.
And this is a roll call on the motion to adjourn. Hoffner.
Hoffner, aye.
Hoffner's aye. Minor.
Minor, aye.
Minor's aye. Mosier.
Mosier, aye.
Mosier's aye. Schramm.
Schramm, aye.
Schramm is aye. Weber.
Weber's aye.
Weber's aye. Benson.
Benson's aye.
Benson's aye. Sarda.
Sarda, aye.
Sarda's aye. Fertig.
Burdick, aye.
Fertig is aye. Mayor Johnson.
Johnson is aye.
Mayor Johnson is aye. Motion passes 9-0.
All right, we are adjourned. Thank you, everyone. Get some sleep. Take care.